We recognize that we meet on the unceded territory of the Algonquin and Anishinaabe peoples. Today's meeting is taking place in a hybrid format pursuant to standing orders. And I want to remind participants of the following points. Please wait until I recognize you by name before speaking. For those participating by video conference, please note that there will be a little globe at the bottom of your screen, and that is for translation, so you can pick which translation you want. And you mute yourself and your mic when you're not speaking. A reminder that all comments should be made through the chair. And for members in the room, of course, if you wish to speak, please raise your hand. And the clerk and I will manage the speaking order as best as we can. We appreciate your patience and understanding. I also want to mention that I heard from the interpreters that any recording of video or audio recording that is on your phone should not be used because it does bother their ears. Just for those who may think they want to do it in future. Pursuant to Standing Order 1082 and the motion adopted on Wednesday, April the 15th, 2026, the committee will begin its briefing session on Prescribe It. And before proceeding, I'd like to inform members that yesterday, the clerk situated a proposed budget of $1,500 for the meeting we're having today. And it seems it was the pleasure of the committee to adopt. Is it? Good. Seeing nobody saying other, I will accept that it's adopted. Today we have a 3-hour meeting today. From 3:30 to 4:30 p.m., we're going to begin with our first hour. But before we begin to do that, I just wanted to tell the committee that we have a bit of a conundrum. Every time we have a request from the committee to get material, any kind of material whatsoever, excuse me, that's not from a department, or it's from private sector or individuals or whatever, we as a committee have to translate this. It's costly to the committee, and we are asking for a lot of stuff, and it's going to cost us a lot. So I just wanted to ask you to think about this when you're making motions to request information. Thank you very much. Excuse me, guys. I'm just having really bad allergies today. Yes, just let me finish. Before we begin, I will begin with TELUS Health today, who is going to be present virtually. But you have a question, Mr. Blanchette-Jonca?
Merci, Madame la Présidente. Simplement pour comprendre votre point que vous avez amené, qu'est-ce que vous voulez dire dans le sens que...
I just want to understand your point. What exactly are you saying? You're talking about the cost of getting information, the cost of translation into both official languages? That's what you mean?
Money, but it takes time. Okay. And sometimes delays us getting the information because we may have to do it. Right. If we're asking for it from any group other than a public institution that's federal or from a department. Right. Other people don't have that ability. They will send it to us in one language. Then we have to translate it. The point is that it takes a while to get it translated so that the information is often delayed. And if we get a lot of those, we may have to go and request more money for this committee for this particular reason. Just wanted to flag it for you, that's all.
Oui, permettez-moi de vous exprimer mon désaccord.
If I may, I disagree, Madam Chair. In a democracy, there is no cost to truth and receiving information. And as a member of Parliament, it's my privilege, my parliamentary privilege, to get information in both official languages. So I feel very ill at ease to hear you say that getting all the information we need might cost too much money. And I think we can debate what is too expensive. It's sad to hear you say that you want us to stop requesting translation because it might cost too much money.
Mr. Blanchette-Jonca, please do not jump to conclusions. I'm informing you that when you I'm just informing the committee of something. If the committee wishes to request 1 million pieces of paper, they're free to do so, but they just should know what I'm suggesting. We're having a problem with time, having to get translations. We have to wait while that happens because we're not the only standing committee and other people have to get. I'm just informing you about the reality. I'm not suggesting you stop what you're doing. I'm not suggesting that you truncate any requests. I'm doing none of that. I'm just giving you a piece of information. That is all, Mr. Blanchette-Jonca. Thank you. Now, tell us who's here today as our witness. As you can see, Mr. Racho Bachavarov, Vice President of Provider Solutions, is online. And welcome. We start with you giving us a 5-minute presentation. After that, and I will give you a shout out to 1 minute so that you can kind of wrap up if you think you're going to run out of time. But you will have time after that when you get questions and answer period for you to elaborate on some of the things you may or may not have had the ability to finish. Thank you very much and welcome, Mr. Bachavarov. I would like to start now. 5 minutes, please.
Thank you, and good afternoon, Madam Chair and members of the committee. My name is Racho Bachvarov. I'm the Vice President of Provider Solutions at TELUS Health. I'm an engineer by training, and for nearly 2 decades, I've been focused on the intersection of healthcare and digital innovation. I'm pleased to be here today to discuss the technical delivery and the lasting value of the Prescribed platform, and I apologize that I was not able to attend in person given the timelines. I want to start by providing some context on who we are. TELUS Health is a national and global leader in health technology operating in over 200 countries and territories. Our mission is to create a world where healthcare is more connected, more secure, and more accessible. In Canada alone, our technology supports tens of thousands of physicians, pharmacists, and allied health professionals who rely on our systems every day to provide care to their patients. It was this deep expertise in the Canadian healthcare landscape that led TELUS Health to be selected as a technology partner and provider for Prescribe IT. Our mandate was clear: to deliver a first-of-its-kind, enterprise-grade national e-prescribing platform. This was a sophisticated piece of national infrastructure designed to meet the most rigorous standards established by the federal government and Canada Health Infoway. TELUS is proud of the work we performed, building this platform to an exacting standard, building it reliable, secure, and delivering for Canadians. When discussing the resources allocated to this project, it is important to view it through the lens of a long-term infrastructure commitment. Over the 9-year duration of our partnership with Canada Health Infoway, the total investment for the platform and subsequent incremental enhancements was totaled at $98 million, over which time TELUS processed over 180 million prescribed transactions between prescribers and pharmacists. This represents an annualized investment of approximately $10.9 million, inclusive of the cost to build and maintain the infrastructure. This funding did not just build a static piece of software, it sustained a living, evolving ecosystem. It covered the initial architecture, continuous 24/7 operational support, and significant technological milestones. This project came with a rigorous set of requirements. Infoway required exclusive access to our TELUS Health Exchange platform for e-prescribing, as well as requiring that sensitive health data remain securely within Canada and that the platform be vendor agnostic, so it could work seamlessly with all software providers across the country in all provinces and territories. This was not a simple off-the-shelf application. It was a robust, secure, and highly complex system built specifically to the requirements of the federal government and Canada Health Infoway. TELUS Health delivered on those requirements. From a technical standpoint, the platform was a success. It was built to an exacting standard, reliable, secure, and designed to deliver for Canadians. It performed as intended, creating a dependable digital link between prescribers and pharmacists and enabling millions of secure e-prescribing transactions across the country. We're proud of the work our engineers and health professionals put into this platform. By leveraging our foundational technology, including the TELUS Health Exchange, we were able to provide a sophisticated starting point that successfully processed more than 180 million secure digital transactions for Canadians.
Rappel au règlement, Madame la Présidente, nous n'avons plus de traduction.
I'm sorry, Madam Chair, the interpretation has stopped.
I have paused your speaking time so that you will not lose your time by finding out why the interpretation is not available to everyone.
Today, as the government looks forward to the future of
Just a
healthcare
second,
through-
we're still waiting to see if we can get
apologies.
interpretation. I'm so sorry. I will suspend for 2 minutes.
Problème se reproduit. Vous pouvez continuer. Merci, Madame la Présidente.
Initiatives like Bill S5 and the push for national interoperability standards, the work done on Prescribit serves as a critical foundation. The research and development, the security protocols, and the technical architecture developed during this project have provided a roadmap for what is possible in a connected health system. At TELUS Health, we remain committed to our role as a partner in this journey. We're proud of our record of delivery. We've provided a proven roadmap for the future of interoperability in the country. While the program's journey continues to evolve, our technical contribution remains clear. The technology worked, it was built to an exacting standard, it was built reliable, secure, and it delivered for Canadians. Thank you, and I look forward to your questions.
Thank you very much. Now I'm going to go to Mr. Bacharov. I'm going to go to what is a question and answer session. The first one is a 6-minute session, and the 6 minutes includes the question and the answer. So I'd ask everyone to be thoughtful about their use of their time. So I begin with the first round. Mr. Major for the Conservatives for 5 minutes. 6 minutes, please.
Thank you, Chair. Mr. Bacharov, welcome. Over the life of Prescribe IT, what is the total dollar amount TELUS Health received from Health Canada Infoway in licensing, service, and development, and any other fees? A specific dollar amount, please.
Yes, so over the course of the 9 years that we supported the program, TELUS Health received a total of $98 million which averaged at about $10.9 million per year to build and operate a secure national network that can support provincial differences across Canada.
Could you provide a detailed breakdown of that, please, to the committee?
I'm not in a position to provide a detailed breakdown at this point, but I can share that there was a 89.5 million base plus another 6.4 million, which were for approved change orders.
So I guess it's kind of puzzling because we heard that the total amount was there's $150 million missing out of that amount that we've been told that had been paid out. So was there any other funds that you received for other services?
I believe it's important to clarify roles and responsibilities. Those were the monies received by TELUS. The other funding went to the program operator.
Okay. Does TELUS Health plan to offer an e-prescription service in the future? Yes or no?
Leverages TELUS's pre-existing and proprietary technology, which was
Great
used
question.
to enable the services.
It was just a yes or no answer. It was, do you plan on offering an e-prescription service in the future? Yes or no? TELUS Health.
Given our investments in this technology, there's definitely
There at the very first.
opportunities
Was
for
that
us
a
to
yes or a no? You cut out at the very first there.
What I'm saying is that we're strategically looking at opportunities to leverage our technology to be able to help and implement connected care pathways.
So is it
Canada.
fair to say that if TELUS Health plan does plan to provide a service, does it plan to monetize an e-prescription service in the future? Yes or no?
TELUS Health's IP can be leveraged for an array of services, which may or not include e-prescribing services. As I said, that technology already existed, and 85% of the IP was owned by TELUS Health, which could serve as the basis for connected care services.
So it is an
which are
option
broader
then.
than potentially prescribed.
Correct? It would be an option then, correct?
I do apologize,
It is something that we would take
Mr.
under
Mazier, because
consideration.
I think the audio from the online is not coming as consistent. So there's so it's actually not very. I don't know if there's any way to correct it.
It's cutting out.
Yeah, it's like not very like the volume isn't consistent. I don't know if there's a way to. up
Okay,
this
I will
volume.
suspend while we check.
Yeah, because it's. I don't know about you. It's giving.
Sorry,
like-
meeting. I will continue. You have 3 minutes and 45 seconds left, Mr. Major.
Thank you, Chair. When Canada Health Infoway tried to find a private company to take over Prescribe IT, did TELUS submit a bid? Yes or no?
In 2017, we did participate in an RFP process, and we were chosen as the technical provider for Prescribe IT.
So 2017, but the last time when they put it up for sale in 2025, I guess it was, did TELUS submit a bid? Yes or no?
Infoway launched the RFOI process, which was
Let's submit a bid on that.
official. TELUS did not choose to participate in that.
You did not participate. So I find that quite puzzling because you built the program, you got to run the program for almost 10 years, and then you didn't bid on it? Like, what was wrong with that? Why didn't you bid on it?
It's important to clarify roles and responsibilities in this context. We were not the program operator, nor were we responsible for provincial onboarding clinician recruitment. We're responsible for providing the underlying technology to a highly scalable and secure standard, which we've provided over the course of the agreement.
Okay, but why didn't you bid on it? You knew all about the program. Like, was there something wrong with it?
Again, our relationship with Infoway was purely contractual, meaning that we were the technology provider. And so there was no reason for us to move forward with an expression of interest. We were already providing the service, and the service was highly scalable, which was able to enable all provinces process 180 million transactions over the course of the arrangement.
Yeah, and you're not, I guess, and just respectfully, you're not really answering. You didn't really answer the question as why you didn't bid on it. Obviously, there was something wrong with the program that you figured you just would not bid on it. It was not, you weren't interested in continuing on with that program, correct?
That is not what I'm saying. We were under agreement with Canada Health Infoway when this process launched. We were providing the technical capabilities that were required from us by the government.
Okay, I got that. Very good. Does TELUS retain any ownership of the intellectual property underlying Prescribe IT?
As I mentioned previously, when the process started, we already had pre-existing IP of about 85% of the TELUS Health Exchange, which was chosen as the exclusive provider for Prescribe IT.
As of today, how many TELUS...
1 minute.
As of today, how many TELUS employees are dedicated specifically to Prescribe IT?
Over the course of the duration of the agreement, we have approximately 50 employees that were dedicated to running or supporting the program.
As of today, sir, how many are employed with Prescribe IT?
That has not changed.
Are any of the TELUS employees or contractors who developed or worked on Prescribe IT outsourced to workers located outside of Canada? Yes or no?
30 seconds.
That is part of the contractual agreement that we have with Canada Health Infoway, and these are not details that I'm able to disclose at this point in time.
Prescribe IT is being canceled next month. Prescribe IT is being canceled next month. Of the TELUS employees currently staffed with this program, will any lose their jobs?
As I mentioned, we value this technology and invested heavily within it, even prior to this project even existing. So yes, we believe that the underlying technology capabilities can actually be repurposed to support connected care activities in line with Bill S5 and otherwise.
Yes, so they will lose their jobs?
Thank you. The time is well over. Thank you, Mr. Major. I go to Mr. Elson for the Liberals, please. Sorry, Doug.
No worries. Yes. So thank you for coming, sir. In regards to this system that of Prescribe IT, I'll apologize in advance if I have to cut you off. I might have the answer from what you've said and have to go into other questions. In practice, how interoperable was it? Were there problems with a physician that was prescribing on it to a pharmacy that did not use it? Was it seamless at the end user level, or were there some issues where everyone had to be on the same system?
It was a seamless integration with all participating vendors. We provided the technology which was functional and processed again 100 million transactions over time. It was a frictionless experience from the perspective of the services that TELUS provided to InfoWay.
Okay, when you said those that were participating, so did all physicians and pharmacists have to subscribe to this program to do this?
The adoption mandate, the onboarding of clinicians, and also provincial onboarding did not rest with TELUS for this particular program.
All right, so now, were there any issues with the application itself, whether there was some functionality, reliability, or integration to workflows? Had you had any concerns about those?
The reliability was very high, 999, 99.9% of uptime, over nearly a decade of 24/7 operations. So there wasn't any issues with regards to reliability over time.
Okay, and there was no negative feedback from the provinces or providers or any end users about the product or how it worked?
Given our responsibilities in the agreement, we were not privy to having these conversations with provinces as they were onboarding to prescribe it. This was with the operator of the program.
Okay, so if someone was not satisfied with how it was working in their practice, who would they bring these concerns to?
They would bring these concerns to Canada Health InfoWay.
Okay, and had Canada InfoWay passed on any concerns from end users on this product?
We have been participating in providing and supporting user feedback as well through our clinical advisory boards. And the decision on acting on these recommendations and feedback rested with the program operator.
All right. So if there was any negative feedback or problems, what steps did TELUS take to adapt or modernize the product?
We always worked in close tandem, very professionally, with integrity, and with the program operator. Through our engagements, there were, as I mentioned, change and amendments that we were able to complete over the course of the program to help with the targets and the objectives of the operator over time.
Okay, and what was the reason behind TELUS's not wanting to continue with this program?
I would have to rectify that. There was absolutely no reason for TELUS to not want to continue with this program.
All right. Okay. Now, in regards to the electronic medical records market in Canada, what proportion of that does TELUS hold?
TELUS is the major player with regards to electronic medical records in Canada. We operate in all 10 provinces.
Mm-hmm. All right. Now, we had some concerns, heard some concerns from provinces, from providers, that there weren't sufficient improvements to the product, and some had said they were slow or non-existent. Did TELUS have any financial incentive to do this, given the size of their market share in this market?
Canada Health InfoWay was responsible for vendor onboarding and for providing clear specifications as well as dollars to be able to conform to these specifications for the integration on the onboarding of these platforms to the TELUS Health Exchange or the Prescribe It platform.
All right. How much time do I have, Madam Chair?
You have 1 minute.
All right. Thank you. Would more competition in this market, had there been another provider, would that have helped incentivize TELUS in improving its product in this regard?
I would again have to take a step back here. TELUS had worked in tandem with Canada Health InfoWay to improve the product substantially. over the last 9 years, also investing of our own capital. If there were another competitor, they would go through the proper RFP process, and we would compete against them for the service.
All right. So just all right. That's my time. Thank you.
Thank you very much.
Chair.
I now go to Monsieur Blanchette-Jonca for 6 minutes, please.
Merci, Madame la Présidente. Monsieur...
Thank you, Madam Chair. Sir, my question for you, does TELUS hold some items from Prescribe IT, which had been funded by taxpayers' money? Well, when we started the process in 2017, we already owned 85%. We'd already developed 85% of the IP content on the platform, and it involved other services like e-consultations, e-prescriptions. So for us, that value is important, and moving forward, we are going to leverage that for the benefit of citizens. So not everything is under public control, if you will. Well, the 15% under public control are under the control of Canada Health Infoway. Now, could that be transferred without any input from TELUS? Well, the answer is no. So there is a structural dependency of TELUS. Is that correct? TELUS owns 85% of the IP. Have you received patents for Prescribe It over the years? Yes. I mentioned, or rather additional funding. Yes, I mentioned earlier we received $10.9 million per year. Who owns the data generated by Prescribe It? The data belongs to the Canada Health Infoway. What about the aggregate data? Can that be taken? Can that be used by TELUS? Answer: no. Why not? Because it's in the contract. It's something we do not engage in, either within this project or within the project of any other, the context of any other project. I ask the question because we don't have access to the content. Can you provide the committee with the IP clauses, a breakdown of all financial support received since 2017, and benchmarks on the progress of the project since then? Well, I think it's important to note that there has to be trust between Canadians and the private sector when it comes to the disclosure of sensitive commercial information. And there are also technical aspects which belong to TELUS. However, we are committed to following the processes in place in case there is an access to information request. And through that process, as always, since we are a private company, we certainly hope that we will have the right to remove any sensitive information if there is an access to information request, so as not to reveal any of the IP we've developed over the years. We are lawmakers. We expect accountability from government. And if we don't have access to certain contracts between the government and private sector, how can we do our job as parliamentarians if we don't have access to certain data? Well, there is an access to information process, which is there for that very reason. It's not the first time that this kind of information has been required, but some information is confidential, contained in these contracts, in these documents. And we will follow processes since we were the contractor for the Canada Health Infoway. I understand, but do you think that if an access to information request is made, do you think we will get a breakdown of financial support or any other information? Well, we are going to follow the process, which has been well established for many years. What if I told you that there has already been an access to information request, but the information was not forthcoming? I'm sorry, I cannot speak to that. I'm saying that you are playing with us, so I would ask for the information in writing, which I've mentioned before. You've had access to public funding, so taxpayers have a right to know how that money was spent. So right now, some of this taxpayers' money remains under private control. That's what you're telling us. Well, if you file an access to information request, let me remind you that we are not responsible for the program. We will take a look at the request and we will release information, but we will protect IP and our technological blueprint. I'm sure you understand that if that information becomes public, well, there is some sensitive technical information in there, and we don't want to make that public. Sure, I understand IP, the blueprint. That's not what we're talking about here. We're talking about taxpayers' money. Did taxpayers get value for their money? Do you believe they did so with the Prescribe It project? As I said, I was very clear about the money that TELUS received over those years. The platform, as far as we're concerned, worked. We can provide this service to Canadians, regardless of where they live. We were asked to develop technology. We did. It works. It is reliable and secure, and it processed millions of transactions per year. So as far as I'm concerned, as far as TELUS is concerned, we fulfilled our mandate.
Of questions. It's a 5-minute round. And I go to Mr. Bailey for the Conservatives for 5 minutes. Please, Ron.
Thank you, Madam Chair. My first question, the $98 million for the program over 9 years, how much of the $98 million was used to create the 15% of the remaining IP?
I cannot disclose details and split that over.
You are in a parliamentary committee, and the benefit of this parliament, you have privileges. Should you not answer, you could be held in contempt. These are not difficult questions. I don't know why you refuse to answer them.
As I mentioned prior, there was an $89 million of base services and a $6.4 million for 59 approved change orders that were presented to us by Canada Health Infoway. So that is the breakdown if this is what you're looking for.
Outsourcing of jobs, how many?
This was a previously asked question. As I mentioned, I don't have the details in terms of outsourcing.
Can you provide those to the committee?
That will be part of the disclosure of information request as part of the agreement, and we were held by strict.
No. I'm asking.
We were held by strict considerations in terms of what can be hired and outsourced or not.
I'm requesting you to submit those to the clerk for us. Did TELUS collect any of the 20-cent that pre-prescription service fee? And if so, what was done with it then?
That was equivalent across all participating vendors. It had nothing to do with TELUS in particular. As I said, the TELUS Health Exchange or the Prescribe It platform onboarded several different EMR and pharmacy providers. So the dollar figures were distributed in accordance to Infoway's agreements that they've signed with these vendors across the country.
So if I'm doing math quickly in my head, it cost about 50 cents a prescription that TELUS would have received. Is that what the basic cost was? Am I correct in my thinking?
Provided the 180 million transactions, that sounds about right.
Okay. Did TELUS provide any input to the federal government on introducing the 20 cents per prescription fee?
We did not. That was part of the Infoway process.
In your 2022 Competition Bureau submission, TELUS identified EMRs and PMS integration barriers as the main reason for low adoption. What concrete steps did TELUS take to fix them, and why did the barriers persist until shutdown?
So as part of this process and the establishment of our clinical advisory board and committee, we helped Canada Health and FOA with boots on the ground understanding of some of these challenges that you're referring to. This was part of the incremental developments that was then provided by InfoWay to all vendors, not only TELUS. And whether or not they took all our recommendations is completely up to them as the program operator responsible for onboarding and recruitment of clinicians.
Chair, how much time do I have?
You have 1 minute, 11 seconds.
I guess I'm going to close with this. TELUS is getting into so much healthcare areas. You mentioned Connect Care. Now, I believe that you were referring to what the Senate Bill C5 is, not Connect Care that is in Alberta. Is that correct?
Bill S5, yes.
Okay. I was a little confused there when you used that term because Connect Care, my understanding from Alberta, is developed in the United States. It has not, you are integrating with it in certain areas in Alberta, but you are not part of Connect Care in Alberta.
I spoke to the Bill S5 Connected Care for Canadians Act.
Chair, but I'm really having trouble hearing with these breaks, his answers. Can you repeat that answer, please?
You have 16 seconds.
I was referring to Bill S5, the Connected Care for Canadians Act.
Senate Act.
Thank you. That's fine, Chair.
Thank you very much. I now go to Ms. Chi for the Liberals. 5 minutes, please, Ms. Chi.
Thank you, Madam Chair, and thank you to the witness for appearing today. My first question is about when you first developed this program or the system, because you mentioned TELUS Health started developing the system even before Prescribe It was won the bid for e-prescription. Can you explain, without, I understand there's issue with protecting IP, without compromising that, just explain the full scope of work involved in developing and building the system? And who did you consult when you first built the system? Did you consult with pharmacists, clinicians, and was it a fulsome sort of consideration across various professions?
Thank you for the question. Even back then, we realized that connecting care and basically bridging the gap of data silos is going to be important for the future. And given TELUS's footprint with pharmacies, EMRs, and even some hospital-based solutions in Quebec, we recognized that this would be a critical infrastructure to provide connectivity. And this program started by looking at e-prescribing in particular, but also not limited to that particular service, as we know that clinical communications is also something that is of high value. So the goal was really to look at how we can reduce inefficiencies for the healthcare ecosystem, particularly attacking the fax situation that we know still plagues our system quite significantly. So it was our answer to be able to digitize a lot of these paper-based interactions when we started developing the TELUS Health Exchange. The opportunity with InfoWay came at about 2017, and this is where they required exclusive use of our technology that we provided as part of our agreement.
Okay, thank you. And for the uptake, because I think when it was mentioned that the uptake was low, what is your sort of take on what was the cause of that? Was it because of performance of the product or the functionality of itself? And what did you do to? Because I understand since the start of the program, there were many changes, right? Change orders as part of the processes based on the feedback from pharmacists and physicians.
Yeah,
What is your sort of take on why the uptake was so low?
And it's really important to separate the roles and responsibilities here. Our goal was really to provide a highly scalable, highly performing, very secure platform that allowed to connect multiple different systems in multiple different jurisdictions and process millions of transactions. When it relates to adoption objectives, these were primarily or exclusively driven by Canada Health Info with regards to provincial onboarding activities, signing of the agreements, vendor onboarding. And when I say vendor, I'm talking about EMR, pharmacy vendors.
Madame la Présidente, il n'y a plus de traduction.
There's the interpretation has stopped again.
Again, I will suspend at this particular time. We
maybe repeat a little bit of what you said?
Yeah, of course. I was mentioning that we started down this journey, and we were looking at market trends with regards to the TELUS Health exchange when we were building it prior to being engaged with Canada Health Infoway. And so there was a recognition that in order to be able to reduce reliance on antiquated technology such as the fax, and given the footprint that TELUS Health had in terms of pharmacies and electronic medical records, there needed to be something that we wanted to put in place to address this critical issue that is still plaguing our healthcare ecosystem to this day. And that's why we started down this path, and definitely consulted with both pharmacists and clinicians. We also have medical directors as part of our own staff that supported this development. And in 2017, we won the competitive bid for the e-prescribing service that did require exclusive use of that platform in order to deliver the service to Canada Health Infoway. And we've been providing that service since then.
39 seconds.
Oh, thank you. Maybe just quickly, from this experience, right? Given the low uptake, what would be sort of your takeaway and lesson learned, to best support, future broader adoption of the technology?
One thing that I could table is we did develop a white paper that had identified certain recommendations, which we were calling systemic barriers in terms of things that can be done based on international experience as well. When you look at other countries such as the United States and Germany, in how they've helped with adoption activities related to e-services such as e-prescribing. So that white paper is available and outlines our thought leadership and recommendations in that regard.
Perhaps you can send it to the committee, please. Thank you.
Yeah, if you can. Yeah, thank you. That's my time, I believe.
Yeah, your time is up. I now go to Monsieur Jean Blanchet-Jonca for 2.5 minutes, please.
Monsieur Bergevin, vous avez confirmé deux choses importantes.
Thank you. Two important things. You said you have 85% of the IP, but there is still a structural dependence. Can the government use what was developed with or without the authorization of TELUS? The government can use whatever in the 15% was funded by taxpayers. Does TELUS still have to approve the government use of that data? The government can use the data in any way it sees fit in the partnership with TELUS. There are no licensing conditions or anything like that on the part of TELUS? No, not at all. Why do you believe the program will end? You said that we've done our job. At the end of the day, it was good but not good enough for you to continue working with the platform. Well, I wouldn't frame it that way. If you look at our mandate, we fulfilled that. If you want a technology to deliver a service to 40 million Canadians, it exists. The fact that the program is evolving or transitioning as we are speaking, that was not our decision. It was the government's decision. I understand, but if something is good, you keep it, but you're not keeping it, and we don't understand why. As far as TELUS is concerned, we didn't drop the ball. We didn't drop anything. As I said earlier, we delivered what we were contracted to do. We did exactly what we were asked to do. Were you consulted to see if there was any way to convince stakeholders to continue with the program? Can you clarify what you mean? Well, this program is going to end. The platform is going to end. You're saying that you did what you had to do technologically. Absolutely. Infoway launched a new process in 2024 to find new operators for the program. At that time, they knew we had delivered the goods. So Infoway had the experience and expertise to scan the market, and that's what they did. And that was not conclusive, and this speaks to the complexity of developing a national platform. Thank you.
I now go to Mr. Strauss for 5 minutes, please.
Thank you, Chair. Mr. Bacharov, on what date was TELUS notified that Prescribe IT would be terminated?
It was earlier this year that we officially received the termination notification for the program.
On what date did you receive informal or notification or a suggestion that it would be terminated?
I would say a suggestion for this is when the process was launched in terms of scanning the market for a replacement operator, which was in May of 2024, when this official RFOI process was launched by Infoway.
Thank you. You spoke to us about the 85% of the IP that TELUS brought into the arrangement and the new 15%. Did TELUS design that new 15% that now rests with Canada Health Infoway?
We were a service provider. Everything that was done with regards to that 15% was dictated by specific requirements and requests that were done by Canada Health Infoway.
It was dictated by Canada Health Infoway, but you ended up designing it.
We delivered it. The design and everything related to this, it was done to the exacting standards that were provided to us and specifications that were provided to us.
You designed it? I'm not seeing the distinction here. Did you design it and then deliver it, or you delivered it but didn't design it?
We delivered it based on the design and specifications that were provided by Canada Health Infoway.
I see. Okay, thank you. Of the $100 million that TELUS received from Health Infoway, how much of that became profit?
Those are details that would be disclosed should the request of information go through.
Okay. Does TELUS lobby the federal government?
We participate in all official channels as it relates to engaging with federal government on many different aspects.
Take that as a yes. Did TELUS over the last 10 years lobby the federal government regarding the issue of prescription platforms?
This was not our mandate, as previously noted. The program operator was not TELUS Health. We provided the technology and the services and the backbone required.
Sorry, simple question. Over the last 10 years, did TELUS lobby the federal government regarding prescription platforms? Yes or no?
We were under contract with Canada Health Infoway, and we were very respectful.
This is a different question. Thank you. Thank you. I know you're under contract. Can you please answer the question? Was TELUS lobbying the federal government regarding prescription platforms?
That's all I can say about that.
Okay, Chair. Could the committee please direct the witness to answer this question?
I can only direct the witness to answer the question under current laws with regard to privacy and industry regulations. You've asked him the question. He will have to explain why he doesn't answer it with regard to privacy laws and IP laws in terms of, use of IP. That's personal. I have no idea what we can do. We cannot force him to answer a question if it's against those laws. Is answering the question going to violate legislation, Mr. Bacharov?
My perspective on this is that we were under agreement with the federal government to deliver a service. That service was actively being deployed, and we were actively developing that service. I don't understand why would we need to lobby on e-prescribing platforms being part of the deliverable of the service at the same time. So I'm not sure I understand exactly the question, to be honest. We were under contract. We were delivering an e-prescribing service that was working. It had scale, national, secure, to millions of transactions and Canadians.
Lobbyists register. There's a national lobby register. They come and they lobby politicians. This is a matter of public record. I'm asking if TELUS was engaged in that activity.
Broadly speaking, yes, but for what purpose?
Okay, thank you. I don't know why that was so difficult. There was $98 million you said was received from Health Infoway to TELUS. Were there any other monies received from any other sources in addition to those $98 million over the period of time you were looking at for this program?
No, that was all inclusive.
Okay. Can you explain to me technically, so what was achieved with the $100 million and what the IP was? Like, to my understanding, prescriptions can be faxed to a pharmacy. They can be digitally faxed to a pharmacy. Like, what problem was solved? So I can send from any EMR a prescription to any pharmacy. The pharmacist can receive it. What was the value add here for the $100 million you received?
It was a scalable technology that connected not only TELUS platforms, but all platforms, like I mentioned previously, EMR, pharmacies, across different jurisdictions, which have different ways of delivering and differences in how they deliver healthcare. So there were extensive negotiations done by Infoway when we were onboarding a net new province, which required adjustments. Yes, today you can fax a prescription from an EMR to a pharmacy, but that is a very antiquated way of processing digital health information. There's high level of inefficiencies when you have to retype information. Fax is an unreliable technology where information can get lost as well. So this digital health infrastructure enabled a secure transmission of that information that avoided duplicative entry and also saved time for patients.
Thank you. The time is well over, but I allowed the answer because it was one that I think everybody wanted to hear. Now I go to Ms. Sidhu for the Liberals. For 5 minutes, please. This meeting, including pauses for suspension, will end at 4:44. So we just have time for Ms. Sidhu, and then we will have to go to the next hour. Just to let you know. Thank you.
Thank you, Madam Chair. My questions to Ms. Bacharov before getting into prescribe IT. Would you agree that without a common national standard like those proposed in Bill S5, digital tools such as e-prescribing will face limits in any adoption?
TELUS is a great supporter of Bill S5 in terms of providing, I would say, the overarching strategy and direction of enabling interoperability and prohibiting data blocking, which are things that I believe are essential, the essential next step to connect Canada's fragmented health silos. So we're very, from a TELUS Health specific perspective, we see this as definitely in line with our strategy. And as I explained previously to this committee, we were already thinking about this and down the road and down the path of developing that technology even prior to the Prescribe It agreement itself. And so we do believe that Bill S5 will serve as sort of the overarching blueprint of how connected care can function in Canada. But obviously, there's provincial realities that all of us are going to have to face.
Okay, thank you. And could you walk the committee through TELUS Health's role in designing and delivering Prescribe IT and how decisions were made around the platform's structure and functionality?
Yes. The technical components and the platform that we provided were already existing. And we worked in close partnership with Canada Health and FOA on any improvements or change requests and change orders that they provided to us. So it was a very tight and strict process in terms of what gets approved, what money gets paid according to milestones. So we met with Canada Health and FOA on a very, very regular basis, weekly, bi-weekly, quarterly updates as well, to ensure that there's tight process and governance around anything around how money was spent and provided to TELUS.
Thank you. Could you speak to how the new open standard model addresses governance challenges and creates a more inclusive system-wide approach to decision-making? You talked about the barriers you face that you're already submitting to the white paper to the committee, but how it's appropriate to relying on one group or single model, how we can work better.
The challenges as a technology provider, when you look at Canada, and obviously we operate in all jurisdictions, is often we're faced with complex and very different ways to integrate, operate, and abide to standards across the different jurisdictions. So it is very welcoming to see from our perspective that there is an ability to talk about creating a national or open standard that is consistent across jurisdictions. So therefore, for large tech providers such as ourselves, this becomes a much easier path to integration and enabling connected care systems to be able to exchange information at scale. So we do believe that this is a welcome change as part of legislation that is being tabled, and Bill S5 in particular, to create that national strategy in how we can connect these disparate systems without having to redo things on a custom level within every province or jurisdiction.
From a vendor perspective, were there limitations in the product itself, whether in usability, integration, or workflow, that may have slowed adoption among providers?
Is this a specific to Prescribe It question? So, as mentioned before, we worked in close collaboration with Canada Health and FOA and stood up physician working groups where recommendations were provided on the basis of the end user perspective. And even though we were not responsible for clinician recruitment nor jurisdictional onboarding activities, so we did participate in those workshops and provided our feedback that Canada Health and FOA took some of it to implement enhancements on the system and also on the TELUS Health Exchange and the switch overall.
Thank you.
Yes, that's it. Thank you, Ms. Sidhu. And I now want to thank Mr. Bacharov for his time and for his information. I asked if you would remember to send that white paper to this committee, and we will distribute it here. And I want to thank you again for your time, and I will suspend the meeting to the next hour and the next witness. Thank you.
Thank you, Madam Chair.
To resume,
Point of order?
I would. Yes?
Yeah, since we've started, we're.
Well, the meeting hasn't resumed yet. I'm just about to resume it now. Sorry, what are you asking?
We'll wait till it's resumed.
Okay. Now, I resume this meeting, and I would like to welcome the witness joining us for the second hour. You have a point of order, Mr. Major?
Yes, since we're starting at 5 o'clock, I would ask for the clerk to check how many resources we have so we can continue on for another 2 hours.
I think we have resources for 3 hours. We are looking at all of that, and I could ask the clerk to check if we have more than that. If we're going to go per hour like we're doing, then we are going to have to take, that's why I always don't like these broken up meetings that take too much extra time. But we will check for resources to see when we can end. We will, whenever we start the third hour, we will end at the end of the third hour.
Yeah, as long as we have resources.
Yes.
If you
I
could
think
check
we're
for me,
gonna
Chair, that would
be
be
able
great.
to have some resources for that.
Okay.
I don't
Thank
think
you.
it's going to be that long.
Okay.
Okay, so thank you. I now want to welcome the witness joining for the second hour from Canada Health Infoway, Michael Green, President and Chief Executive Officer, by video conference. Welcome, Mr. Green. And thank you for coming.
Hello.
I will just quickly explain to you what the protocols are. You have 5 minutes to present. I will give you a 1 minute shout out, literally, and then you can wrap up what you have to say, and 30 seconds if I think you need one. And then we will go to a question and answer segment. So if you don't get to say everything you want to say in your opening remarks, you will get a chance to elaborate during the actual question and answer. So I shall begin now. For 5 minutes, please, Mr. Green.
Bonjour, Madame la Présidente et membres du comité.
Hello, Madam Chair and members of the committee. My name is Michael Green, and I'm the President and Chief Executive Officer at Canada Health Infoway.
Acknowledge that the land now known as Canada is the traditional territory of the First Nations Inuit and Métis people who have lived here since time immemorial, and I recognize their enduring presence from coast to coast to coast in the spirit of reconciliation. Thank you for inviting me to appear today on behalf of Canada Health Infoway. As an independent, federally funded, not-for-profit organisation, Canada Health Infoway has worked in partnership with successive federal, provincial and territorial governments to advance digital health and connected care across Canada since 2001. Our approach is collaborative by design. Major national initiatives and mandates are not directed by a single organisation acting alone. They are shaped through collaboration with jurisdictions and partners and with oversight by our Board of Directors, which is governed by representatives from the federal, provincial and territorial Deputy Ministers of Health and Health Canada. Our work is guided by a clear objective to help ensure that patients and their care teams can access the right health information securely, efficiently, and when it is needed. Our role is to help build that shared digital foundation to support safer, more connected care for patients across the country. Prescribe It was launched as part of that broader effort to modernize how health information moves through the healthcare system. It was supported over time by successive federal governments and developed in collaboration with provinces, territories, clinicians, pharmacies, and technology partners. Its purpose was clear: to establish a safer, more secure, and more modern approach to e-prescribing in Canada. Through Prescribe It, Canada Health Infoway helped build a national technical foundation for e-prescribing that did not previously exist. We achieved technical readiness across 95% of pharmacies and vendors. We established common workflows, strengthened digital trust, and advanced the standards and infrastructure needed to support secure prescription exchange at scale. This work created a significant pan-Canadian asset, one that improved the system's readiness for interoperable e-prescribing and reduced future implementation effort for governments, vendors, and care providers. Through that process, provinces and territories express differing needs and approaches for how e-prescribing should continue to develop. As Canada Health Infoware and our partners looked to the future, it became clear that the next phase needed to build on that foundation in a way that is more flexible, scalable, and aligned with the realities of Canada's diverse health systems. That is why the work is now transitioning to a national e-prescribing standard. In that context, Canada Health Infoware's board supported a transition to a standards-based approach. That decision was informed by extensive engagement with partners and focused on responsible stewardship of the work completed to date. The transition is an evolution from a centrally operated service model towards a standards-based jurisdiction-led approach. It allows provinces, territories, and vendors to advance e-prescribing in ways that align with local priorities, local needs, and readiness. The technical, clinical, and standards-based progress achieved through Prescribe It continues to support the system. The objective is to preserve the value of that work as we undertake an orderly transition to an open standards model. A publicly available national standard supports patient safety and care by enabling consistent, secure, and reliable exchange of prescription information across systems, vendors, and care settings. At Canada Health Infoway, our role is to work with governments and system partners to build shared digital health foundations that improve safety, reduce fragmentation, and support better care. That is what Prescribe It was designed to do, and that is the foundation of the work that it helped establish. In summary, connected care requires common standards, trusted infrastructure, system alignment, and collaboration across jurisdictions. Canada Health Infoway's work on Prescribe It has helped move Canada further along that path and has informed the next stage of national e-prescribing in a practical and responsible way. Thank you, and I look forward to your questions.
Very much. I now an answer segment. It's a 6-minute segment to begin, and I begin with Mr. Major for the Conservatives for 6 minutes, please.
Thank you, Chair. Mr. Green, how much money has been spent in total on Prescribe It to date? Just a dollar amount, please.
Sorry, thank you for your question. I think in our opening statement and the documents we provided, we've described the investment that's been made in the program. And
so how much was that? How much was that?
Overall, 250 million was the amount. Yeah.
So TELUS just told the committee here that they received $98 million for Prescribe IT. So what was the other $150 million spent on?
In designing and building the system, as I mentioned in my opening statement, our approach is one of collaboration, and it involves a number of different partners. So in addition to the hub provider TELUS, there were other IT companies and EMR companies.
For Prescribe IT, so $150 million was to develop it more?
Prescribe It was run as an 8-year program and involved investments across a wide variety of our partners, including the provincial jurisdictions and territorial jurisdictions.
So what other IT companies were involved in designing it and improving it?
In Canada, there are a number of organizations that operate electronic medical records, for example.
Yeah. So could you please table that? Could you please table those companies that participated in that $150 million?
I can certainly provide that information if the committee requests.
Thank you very much.
I don't have the information to hand.
That'd be perfect if you could table that. Mr. Green, over $250 million in taxpayer money has been spent on Prescribed IT since 2016. As of today, what percentage of Canadian prescriptions are transmitted through Prescribe IT or Prescribe It?
Right, Prescribe It. Thank you. As of today, we have connected the system to 95% of pharmacies and 95% of vendors. We recognize that the system can transition into a new approach.
Okay, that answered the question. So thank you. 95%, that's good. Mr. Green, how many applicants responded to the May 2024 request for expression of interest entitled The Future of Prescribe It to take over the program?
I can't remember the exact number of applicants that replied to it, but certainly more than 10. I would say.
Okay, could you provide the list of respondents to the committee, please?
If the committee requests that information, we can do so. Obviously, some of it is commercially confidential.
Yeah, I just did, so that'd be great. Canada Health InfoWay, Mr. Green. Canada Health InfoWay spent nearly 2 years searching for a private company to take over Prescribe IT. That search was in its final stages when the board voted to abandon the search and terminate Prescribe It. Why was the search all of a sudden terminated? If you had 98% of the pharmacies that we just learned here, everybody was covered, why did you terminate it?
As I mentioned, it's quite common when you look at IT initiatives in healthcare that there's changes in technology over time. We operated Prescribe It for 8 years now. And as I mentioned, we found in consultation with our partners and also with our board of directors, we decided that a more effective approach going forward was going to be looking at an open standards approach, which would suit the diversity of the different health systems across the country.
Okay. How many applicants initially applied to develop and run Prescribe It?
The initial process that we used for selection was approved by the board of directors.
Yeah, but how many applicants?
Included requisites.
How many applicants?
Again, I don't know the exact number of applicants, but this is information, again, we could provide after the meeting if the committee decides to do so.
Would you know if TELUS Health was the lowest bid?
The criteria that we used included quality matrix, the ability to deliver the program, and many other things other than just the financial criteria. Okay.
On what specific date did the Canada Health InfoWay Board vote to terminate Prescribe It?
The board of directors considered all the different pathways for sustainability and made the decision to opt to go for the open standards approach at the latter part of 2025.
So what specific date did Canada InfoWay Board vote to terminate Prescribe IT? Was that years in advance? 2023?
November the 17th. Yeah.
2024?
2025. Yeah.
Okay. Did the federal government or Health Canada recommend the termination of Prescribe It to the Canada Health InfoWay Board? Yes or no?
The pathway forward for Prescribe It was really decided by the board of directors, and which is, as you heard from my opening remarks, populated also by deputy ministers' appointments.
Yeah, so I guess the question was, did the federal government or Health Canada...
Excuse me, Mr. Major. It would be nice if those of us who want to hear can let the witness just round out their sentence, as opposed to cutting them off in mid-sentence, because I would like to hear what he's trying to say. It may not, as long as he doesn't go on too much. Go ahead.
So the question was yes or no answer, Chair. And Mr. Green. So did the federal government or Health Canada recommend the termination of Prescribe IT to the Canada Health InfoWay Board? Yes or no?
The decision was made by the Canada Health InfoWay Board.
Thank you. Now we've run really overtime here, a minute overtime actually. I'm so sorry to say, guys.
You still didn't answer the question.
I wasn't paying attention. But now I go to Ms. Jacek for the Liberals for 6 minutes, please.
Thank you, Madam Chair. And Mr. Green, I'd like to go back to the $250 million, the federal investment. TELUS received some $90 million. So the remaining $160 million, did you say in a previous response that that went to other EMR providers? Where did that remaining funding, where did it end up?
Well, thank you for the question. With the program, there were multiple steps that had to be taken to implement the prescribing service. The design of the service itself, the operation, and then also integration with provincial assets, integration with health IT systems that are used across the country, also connectivity with pharmacies. So it's a very complex process. We also had to ensure that the system is very secure, that it meets very stringent privacy and security standards, that it's up and available. So in answer to your question, there are multiple sources of where the funding was utilized, including the annual operation of the system as well. Again, you know, it's possible to provide some of the information. It's not an easy answer to this question. You know, I think and I would also like to say that at every step, we had a regular review of our expenditures and the progress of the system by the board of directors and reported through that mechanism as well, at least on a quarterly basis.
Thank you for that. I must say that on the face of it, to replace a fax system with a digital system, it seems like an incredibly expensive proposition, which, to be honest, puzzles me. But perhaps you could give us, from an on-the-ground perspective, what was the actual experience of implementation and uptake amongst providers that you heard, and what do you see as the main reasons the program ultimately came to an end? We did hear about some 57 change orders. Could you maybe describe some of the more important of the changes that were required? And was it because there were so many changes required that the Board of Canada Infoway terminated TELUS's involvement?
Thank you again for the question. As I mentioned in my opening statement, you know, the system provided a technical foundation for e-prescribing, and you know, through time, we really looked at how the program was progressing. As I mentioned, we had 95% uptake by pharmacies and technology vendors. And on review, the system's future has a brighter path as an open standard. As you are aware, Canada has a diverse health system. Different provinces and territories have different priorities. And so the new approach, which is a transition, not a curtailment of the system, you know, I think we have built some very good assets for the country that are going to be utilized in the open standards approach going forward, which we believe will attract a higher level of adoption.
Why did physicians not adopt? You've talked about the pharmacies at 95%. Were you actively promoting prescribe it to physicians across the country? How did that work? Or didn't
the way
work?
that Canada Health Infoway works in collaboration with our partners, in principally the provinces, the territories who operate the health systems, and also the federal government. We work with the technology providers, we work with the pharmacies, and we worked with clinicians, not at the individual clinician office level, but we would have meetings with society groups and you know, associations to ensure that the clinical side of the program was addressed.
How much time do I have?
You have 1 minute and 3 seconds.
Okay, thank you, Mr. Green. You did talk about moving towards standard setting rather than reliance on a single delivery model as a more effective way to encourage more vendors to enter the space and better meet the needs of providers and patients. Could you sort of elaborate a little bit on what is meant by standard setting?
Yes. What we mean by that is that rather than having a single system operating, which has to be adopted, we can actually come up with standards, which is a very common practice with other health solutions these days, where systems have the ability to connect to a variety of different IT systems within the health structure without having the need to do a lot of reprogramming. So it's a more kind of simple approach going forward, which has developed over the last few years. When Prescribe It was initiated 10 years ago, the kind of technical excellence was that we'd seen was a kind of national single type of approach. Now it's a more flexible standards related approach going forward.
Thank you.
Thank you. I now go to Mr. Blanchette-Jonca for 6 minutes, please.
Thank you, Madam Chair. $250 million were invested. How can you explain that this year less than half of prescriptions are made electronically?
As I mentioned, we were really responsible for the design and collaboration with our partners through this process. So, we have established the technical foundation for e-prescribing, and we had readiness of 95% across pharmacies and vendors. We're going to be moving to an open standards approach to take account of individual differences between the different health systems in Canada and improve the flexibility.
Monsieur Green, la question, c'est pourquoi.
Well, the question is, why are prescriptions only 5% of transcriptions made electronically today?
Basically, when we reviewed the program with our board of directors, we had a couple of different pathways to continue. We could continue with the existing model. We could look for an open standards approach and also a cost-sharing approach with the provinces. When we looked at the different and presented the evidence and the progress we'd made so far to the board of directors, the decision was made that the best path forward was to go for an open standards approach for the continued adoption of the program going forward.
Okay. Il y a personne qui s'est posé la question pourquoi.
No one wondered why you only have 5% of e-prescriptions? You don't have an answer to that question?
I think, again, we have worked largely, and our mandate is to work with the jurisdictions, the health systems, to work with the technology vendors, and to work on the implementation of the technology. With review of the pros and cons of the approach, we decided, and the board decided, that an open standards approach would be more effective going forward.
Bon, ça répond pas.
Well, that doesn't really answer my question, Mr. Green, but let's move on. You said in November 2025 you concluded that Prescribe It wasn't viable anymore. Is that correct?
No, I think the decision in December 2025, when we presented all of the information to the board of directors, which includes representatives from the provinces and territories, they decided the preferred option going forward would be to migrate to an open standard rather than continue with the existing approach.
Bon, M. Green, j'essaie de comprendre, c'est quand que vous avez su.
I'm trying to understand when you knew, following internal assessments, that Prescribe It was not viable anymore.
I think the board meets on a regular basis, and we would at least have a quarterly review, a major review of performance. We started to look at the options going forward in 2023.
La date, M. Green, la date.
Sorry.
We are April 21st, 2026. That is a date. I want the date when you determined that Prescribe It was not viable anymore.
The board of directors met in November and December last year and decided to pursue the path of an open standards approach.
Okay. M. Green, je sais pas comment.
Mr. Green, I don't know how I could be more clear. I want the exact date when you determined that Prescribe It was not viable anymore. Did you keep on investing after you determined it was not viable anymore?
Yeah, thank you for your question. And as I mentioned, it's not an individual or a single group that makes those decisions, but it's a decision that really comes from the governance of the organization and the board. And the decision to go to an open standard to use and it was made in November, December of 2025.
Donc, c'est qui a autorisé la poursuite du projet?
So who authorized the continuation of the program after December 2025?
Again, the process for transitioning from Prescribe It to the open standards was again approved by the board and of directors in that at the same time.
Donc, a continué à dire de.
So if you decide to continue, so you decided to continue with the program even though it was deemed not viable anymore.
I think in preparation for moving towards an open standard approach, it was necessary to have an orderly wind down of one of the e-prescribing service as we kind of ramp up with an open standard approach. And so there was a notice period that was given to partners to allow them to make that adjustment from one technology to the other.
Thank you. I think we've gone over time on this. I'm now going to go to the second round. It's a 5-minute round. Ms. Conans, for 5 minutes, please.
Thank you. Thank you, Chair. First of all, I want to say quickly, Mr. Green, it's very important that you answer these questions succinctly and that you actually answer them. If you do not answer the questions that the committee members ask, you will be asked to return. So just succinctly, please, I have 5 minutes. Was TELUS the lowest bid for Prescribe It?
Regarding the question,
yes or no?
Tell us whether the lowest bid.
Yes or no?
I can't give you a complete answer for that because it was
Can we
based
table that
on...
then? That if you don't have the answer, you can table that. Okay, my next question. Was the $250 million in tax dollars well spent?
I believe the money was spent appropriately and according to governance of the organization, and that we have a valuable asset that's been put in place that will bear fruit in the future.
Thank you. How widely was Prescribe It adopted? Do you have the raw numbers, the percentage of prescriptions that actually went through?
As you know, I did mention the 95% uptake by vendors and pharmacies.
So 95% of all vendors.
The figures of the prescriptions that went through are in the millions.
Okay.
And if the committee would like to see,
Yes, every question I ask, every question is the committee asking. So yes, that's great. Okay, so you're going to table those numbers. Thank you. It was promised that prescribe it would be financially self-sustaining. So, was it?
The initial program was designed to become self-sustaining through a pathway of
so the goal was to be the goal, but you never were. It never was.
At the stage, the throughput of the system didn't cover the cost.
The $250 million. Okay.
From a self-sustaining perspective.
Okay. We know that you eventually developed a 20% per prescription fee. How much did the federal government collect in total on that fee from healthcare professionals?
That fee was levied against pharmacies, not healthcare professionals.
How much was levied?
I can provide that information if the committee decides
the committee will always, whatever I ask. Yes, so yes, you'll table that information. That would be great. And it was only from pharmacists, you said, correct?
From pharmacy chains and independent pharmacies.
Okay. Another question, Mr. Green. In InfoWay's 2016-2017 year in review, there's a quote attributed to yourself that InfoWay's Prescribe It service will reduce inappropriately filled prescriptions for narcotics, improve the detection of fraud and abuse. Did Prescribe It reduce fraud or abuse of narcotics? Yes or no?
The system was designed to be secure, and so unlike paper, it can't be forged.
Okay.
So I think the prescriptions are accurate.
Okay. So you believe you have proof that it did reduce fraud and abuse of narcotics for the $250 million that was spent.
The benefit of a e-prescribing service like Prescribe It is that it is secure.
Prescribe It did prevent fraud and abuse. Okay. Our understanding is you never accounted for 5%, or you never accounted for 5% of all prescriptions in Canada, or you did account for 5%. Does InfoWay have any evidence at all that there was a reduction in reduced inappropriately filled prescriptions? Or do you have those numbers?
We did, during the course of the program, we have collected a lot of information and, performance statistics, and certainly, if required, that statistics
would be amazing.
Made available.
Thank you. On November 19th, 2016, the Liberal government committed to reducing the harm and costs of opioids with the launch of Prescribe It. Given the state of our opioid crisis, did Prescribe It measurably reduce the harm or costs of opioids in Canada?
I think the program was designed with that functionality. I don't have the information at my fingertips to demonstrate the reduction that was put in place.
Can I ask what your salary is?
Basically, my compensation is decided by the board of directors.
What was your salary in 2025?
As I mentioned, the board of directors decides what my compensation
in 2025.
It is publicly disclosed.
Thank you. What is it in 2025?
I would just say that the board of directors...
You need to answer my questions, Mr. Green.
The board of directors decides my
Chair,
compensation,
can you remind
Mr.
Green?
Quoted.
Chair, do you mind reminding Mr. Green his obligations?
Mr. Green, I would ask that you give, if it's in the public domain, you should just give your salary, please. It's being asked of you. Thank you.
And bonuses.
Including bonuses.
I'm afraid I don't have that.
Mr. Green, you know how much you make. You need to tell this committee how much you make. You need to
Well,
tell
we can certainly
Canadians.
provide.
No, you
can
need to tell.
provide-
You need to
I
tell
am sorry,
Canadians.
we are now 1 minute and 26 seconds over time. Guys, please stick to your time. Come on, 1 minute and 26 seconds. So thank you. I'm going to say, Mr. Green, can
Okay, you need to
disclose
table
your
that
salary
information,
now?
Mr. Green.
Send the information, please, to the committee. Thank you. Mr. Blanchard-Jonca for 2.5 minutes.
Merci beaucoup. Monsieur Green, vous avez conclu en novembre 2020.
Thank you, Madam Chair. In November 2025, you concluded it wasn't viable anymore. Then the transition started. But how much of taxpayers' money was spent after that time?
After 200 can you rephrase that question?
Bon, Madame la Présidente, je vais devoir recommencer. Je pense qu'on...
I'll start again, Madam Chair. I believe there's a problem of comprehension or interpretation here.
Point of order. No, point of order, Chair. I think the next spot is a Liberal spot, yeah.
There are so many questions going back and forth that I'm losing track of time here because people keep asking the questions and demanding the answers. So I'm going to ask people to ask a question. If you don't get the answer, ask the person to send it to the committee, please. Otherwise, we're just going crazy here. And I'm sorry, I will let Mr. Blanchard-Jonca finish because I missed Mr. Eolfson, but you have your 2.5 minutes. You have 1 minute and 59 seconds left.
Madame la Présidente,
Doesn't matter what order you're in, you're both going to get the same time due to you. So may you continue your questioning, Mr.
J'allais vous mentionner que je crois qu'il y a des problèmes.
I was going to say, it seems that there are problems of interpretation because the witness asked me to repeat the question.
Hear the translation.
Yes, I can. I missed a slight part of that, but I believe the question was how much had been spent on Prescribe It since 2025.
All right, will you answer that question, please?
So it would have been about a quarter of the annual running costs of the system that would be spent on that.
C'est quel montant, ça, Monsieur Green?
What amount was that, Mr. Green?
I don't have the exact figure, but it would have been below 10 million pounds.
D'accord.
Dollars, sorry.
Monsieur Green, il y a eu des...
Mr. Green, I believe evaluations were made before you made the decision to cut the program and to transition to a new system. Is that correct?
We spent some time looking at the different options available going forward.
Écoutez, on va essayer d'avoir l'heure juste. Pouvez-vous nous transmettre au comité par écrit les analyses?
Can you send the committee the analyses which led to the decision of the board in December of 2025 and how much of taxpayers' money was spent after that time?
If the committee asked for that information...
Okay. Si c'était à refaire aujourd'hui, Monsieur Green, qu'est-ce que vous feriez différemment?
If you would start over again, Mr. Green, what would you do to make sure things worked out the second time?
As I mentioned, we have, during the time of running the program, done extensive analysis together with the board of directors and our partner and our provincial partners and industry. We made the determination of different paths going forward, and the board really settled on the open standards approach as the method of choice to promote the e-prescribing going forward in Canada.
30 seconds, if you wish. Monsieur Blanchard-Jonca wouldn't get an answer in that
Monsieur
time.
Green, sur une échelle de 1 à 10...
Mr. Green, on a scale of 1 to 10, how do you perceive the performance of the Canada Health Infoway?
I think that's a subjective answer that I may give, but I think that that would be better seen by how our board perceive what we're doing.
Mr. Green, I'm sorry. The question was very simple on a scale of 1 to 10. We tend to eat up a lot of time with this repetition of the board of directors, etc. We know your board makes decisions. Can you say on a scale of 1 to 10, please, as you asked? Thank you.
I think we've done everything we can.
Can you tell
I
us
would
a
say,
scale of 1 to 10, Mr. Green?
I would say an 8.
Thank you. Thank you very much. Go to Mr. Ailson for the Liberals, please. For 5 minutes, Mr. Ailson.
All right. Thank you, Chair. I'm trying to, I guess, understand a number of issues that the answers seem elusive up to now. We hear that 95% of vendors and pharmacists had uptake, but a very small percentage of physicians were using this. Where's the disconnect on this? Why weren't physicians using this? Had problems been identified? Were you getting feedback as to why there were so many physicians that were not, or I should expand, healthcare providers that were not using this? Why that might have been, and what problems could have led to that?
To answer your question, when you look at any digital or any solution, it has to be first of all staged, set up, as I mentioned.
Yeah, sorry, I don't mean to cut you off, but this is it's similar to many of the answers we've heard before. It doesn't answer the question. Were there technical problems identified by healthcare providers that were trying to use a system that accounted for such low numbers of prescriptions or low numbers of providers subscribing to this? Was there? Can you point to any discrete issues that led to low uptake among prescribers?
I think change management is a big issue with individual primary care providers utilizing new technology and new systems. And the decision to move to the open standards approach is one that is seen would encourage a broader adoption of the program. A number of steps had to be taken to adopt the program. A provider would have to sign up, log into a secure system. We had to know that individual providers were indeed who they said they were. They had the ability to prescribe and so on. In some of the provinces, we launched in Alberta and Ontario, were early adopters, and we had about 20% of prescriptions going through the system in those provinces.
Okay, so if you have such low percentage of prescriptions going through your system, could you say this was a successful program if such a low percentage of providers subscribe to it?
I think it was a successful program in terms of the uptake from the pharmacies and the IT systems.
Sir, I'm sorry to cut you off. I'm sorry to cut you off, but we've heard that answer many, many times today. But if 95% of the pharmacists take it up, that does not in any way, shape, or form change that the one of the higher provinces for uptake was 20%. So why how can you have a successful program that only between 5 and 20%, depending on the province in question, of providers are using?
The decision to move to an open standards approach is chosen to increase that. So
yes, I know, sir. But why? Yeah. So why didn't it work? So why did it not work? Because we hear I heard that answer again. I'm sorry I keep cutting you off, but again I keep hearing the same answer. They went to an open standards approach, but I still haven't heard why. For a program that was, by your account, working so very well, why would you change this open standard approach if it was? We've heard many, many times that the board went to this open standards approach, but I have yet to hear a concise why.
The key reason is to improve adoption.
Mm-hmm. All right, but again, if okay, I'm gonna take a different tack here.
Point of order. Point of order.
Yes.
I take the witness is not answering the question. It's pretty simple question.
Now, Mr. Major,
Is my time paused?
Oh, yes, it better be.
About why the witness is not answering the question. Maybe the witness does not comprehend. Maybe the witness does just not,
Does not comprehend,
want
right?
to answer the
All right.
question. Because I have heard this question asked many times. I think, Mr. Green, the question by Mr. Ailson was pretty clear. He said, you said there was, out of 1 to 10 scale, you said it was an 8. Yet there was a 5 to 20% uptake, 20% in only 2 provinces. What was wrong with the system? Why such a low uptake? Why such a low uptake by physicians? What was the problem? Can you tell us what? You decided to change it. What was the problem? You had to define the problem before you decided on a solution. What were the problems? That's what everyone is trying to get here. Thank you.
Certainly, the open standards approach is chosen to approve that adoption. So the key reason that we've changed from a monolithic system to an open standards, more distributed system is to make it easier for physicians to adopt.
Okay, I'm sorry. Yes, I understand what you're saying, but again, it goes back to the same. And I'm going to have to keep drilling down on this because the question has not been answered after many attempts by many questioners.
Well, I'm sorry. Your time is up, so we can't keep drilling. But I think this is getting to be a very difficult question and answer session because we are not getting the clear answers we're asking for. We're getting the same answers repetitively. I think we all know that you moved to an open standards approach in order to help more physicians. Why did your original system not work? Why had it such a low uptake? Is there a reason? You must have analyzed it, sir. What are your reasons? I think that's what Mr. Ailson is trying to get from you. And his time is now up, and I think what we're doing is people's times are ending because they're asking one question over and over and over. So I am asking the question this time, and Mr. Ailson has finished, but I'm going to ask his question of you. Can you tell us what was wrong?
The ease of adoption by primary care physicians and prescribers was lower than expected because of the complexity of adopting the standard, because of the complexity. And so the solution is to move to a different approach to solve that issue.
So you are suggesting that it was the system in itself was too complex for physicians to be able to use it. Is that what you're suggesting?
Yes.
Thank you very much.
Yeah.
Now we're going to Mr. Strauss. Thank you, Mr. Ailson. Thank you very much for your patience. Mr. Strauss?
Great work, Chair. Thank you personally for that intervention. Mr. Green, TELUS designed the program for $100 million. I don't know if that was an appropriate amount or not. I'll reserve judgment on that. But $150 million stayed with Canada Health Infoway. So I would think that if I was dealing with TELUS, I would say, hey, I need you to design the system. It needs to be interoperable with the major EMRs in Canada. It needs to be interoperable with most of the pharmacies in Canada. It needs to be private. It needs to be secure. Go do it for $100 million. What happened with the $150 million? Like, did that demand that you asked TELUS? Did it take you $150 million to decide that that's what you needed to ask TELUS to do?
So TELUS's role was to operate the hub that transmits the prescriptions from the doctor's or prescriber's office to the pharmacy. They were not responsible for integrating it with the different EMR systems that are used by prescribers. And then also within the pharmacy industry, there are 3 or 4 different pharmacy systems that are also available. Now, in order to integrate the TELUS Hub and the Prescribe It program with all of those systems, it required work to be done by each one of those vendors to integrate their system. And so Infoway helped support the vendors do that work so that they could make their system compliant with Prescribe It.
Help the vendors. You paid the vendors to make their system interoperable with the system that you paid TELUS to make?
We had it's a slightly separate issue, and TELUS also, the money paid to TELUS was to build and operate that system over the period of the contract time. So over the 8 years we've been running the program. And then each individual EMR that had to integrate would have to come up with new software. So we had a process where we would procure, negotiate contracts with those vendors to integrate the technology, which is quite common with health IT programs.
Can you ballpark of the $150 million, what proportion of it was paid to Canada Health InfoWay personnel to do the work, and what proportion now ended up being paid to the vendors and the pharmacies?
We do have those figures available, and we did comprehensive reporting on all of those aspects. Off the top of my head, I don't have that information today, but we have all the financial statements that were presented to the board on regular basis.
I look forward to seeing
so we
them
can
tabled.
certainly provide that information for you.
Thank you. Please send it to the clerk. Thank you so much.
$250 million was spent. By my lights, the taxpayer has nothing now. The physicians, the family doctors I've talked to who were using the system, they do not know what they're going to be using 6 weeks from now. I haven't heard any clear answer that way. So $250 million are gone of taxpayer money. Have any board members resigned over this debacle?
We have $250 million have been invested, and we're basically looking at that program going forward. We built a lot of infrastructure using the program, which will be invested going forward. So it's not a one-off investment. It will contribute to the assets that we built with that program going forward.
What are you going to do with the assets? You have the assets. What are you doing with them next week?
Well, they'll be used, to build the open standard approach. We're going to be launching the open standard during May. So that's already being designed. We do have intellectual property of the Prescribe It software itself,
So you're going to
which complements.
Are you going to make that intellectual property public?
We will make the intellectual property available to the provinces and territories. And we will provide assistance and support to our jurisdictions to implement the open standard.
Okay. Can you table minutes of the last Board of Directors meeting with us?
If the committee requests,
we do. Thank you.
Can.
I think we have 9 seconds left, so I will move Mr. Strauss to Ms. G. Thank you.
Thank you, Chair. Thank you to the witness for appearing. This national standard, is it called the E standard? Open standard.
Sorry, the open standard.
Open standard, right? When was this first developed, and what is the timeline for delivering this open standard?
We've been working on that standard for at least a year, and the timeline for release is early May.
May of this year.
Yes.
And how is it going to be delivered to? How is it going to, I guess, trickle down to the pharmacists and physicians? Because if we had time to socialize, Prescribe It, what confidence do we have to make sure that this is going to work?
Canada Health InfoWays manages a lot of digital health standards. It's one of the things we do, and we have a process for launching the standards and also disseminating the information. And so we would organize workshops with industry, with other partners, users and providers, also with the provincial and territorial partners to, educate them and to provide support for implementing the new standard.
Okay, thank you, Mr. Green. And I think my colleague touched on this briefly is the phasing out of Prescribe It and the data that was collected throughout the implementation of the program. When you implement the national standard, are you incorporating these data as well? Like how do we make sure that the lessons learned and the knowledge collected is not lost in the process?
Yeah, so the data is owned by the provinces and territories, and that's in terms of the actual prescribing information that went through the system. So that information is the property of the provinces and territories, and we had built interfaces so that could go into their provincial drug system information systems. In addition to that, we have information that we've gathered on the statistics of use of the system, and certainly that information we would make available to provincial partners as appropriately in terms of privacy laws and so on. So certainly there is a lot of information we gathered during the process that we can use to inform future programs.
Okay, thank you. And I think I would just also follow up on what my colleague asked earlier about the adoption or the lack thereof. When I understand there were a number of change orders that were submitted throughout the implementation of the system. How quickly were those responded to? Because I imagine, if pharmacists are not the issue with adoption, the other side, on the other side of patient serving from the physicians and clinicians side, I wonder if, the constant change order delay or part of the reason, the adoption wasn't very high.
The change orders can take many different forms. Some can be implemented very quickly. Others that may require software changes obviously could be more difficult to implement. But I don't think any change orders actually restricted the provision of the service.
And also another follow-up on what my colleague asked about the accuracy of I guess
1 minute,
the accuracy of the system that it brings, right? Do you have enough data to say or to extrapolate from to say, the way it's delivered, it will make prescription more accurate, it will be less prone to mistakes or abuse? Or is there there is enough data?
We certainly have that. Yeah, we definitely have that information. We can provide performance data, and the system integrity was there, the privacy, security, ensuring the right drug got to the right patient in the correct dosage, and so on.
Oh, okay. Would you say, I don't know if you measure by like the top whatever percentile or 98%, would you be able to table some of those informations as well to committee?
We did do regular reporting. We maintained a dashboard for the system, so we have that information if the committee requires it.
Good.
Chair, point of order.
Yes, sorry.
I just, despite that performance, I would seek unanimous consent that the committee summon the CEO, President, and Chair of Canada Health Infoway, in addition to TELUS Health, to appear for a total of 2 hours together prior to May 6, 2026, to testify on Prescribe It.
I'm sorry that motion. Clearly, we just had
I'm
TELUS
just seeking
Health.
unanimous
Are you
consent.
no, but I have to know what you're asking unanimous consent for.
To summon?
I seek unanimous consent. Pardon?
Yeah. Okay, to summon the CEO.
CEO of TELUS, yeah.
CEO, President, and Chair of Canada Health Infoway.
Yeah.
In addition to TELUS Health, to appear for a total of 2 hours together prior to May 6, 2026, to testify and Prescribe It.
Okay, thank you. So
it's
there
just
is
a unanimous consent.
Is there unanimous consent for this? There is. Okay. So now that was duly noted in our minutes. I just need to ask one question of Mr. Green, please. I am not trying to be ridiculous, Mr. Green. I think I may not be intelligent enough to understand what's going on here. I'm a physician. Before I prescribe anything for my patients, I try to find out what's wrong with them. I check them out, I do an analysis, I look at their past history, I examine them physically. Would it not be, if one was going to embark on a very expensive proposition such as this, wouldn't one have analyzed to note that every province has a different sets of information systems, that pharmacists have 4 different ones in each province? Wouldn't that have come into consideration before we embarked on the whole program? Wouldn't one have done that kind of analysis first and foremost? Can I ask if that analysis was not done? Because I'm hearing that that is obviously what went wrong, that many jurisdictions had many different ways of communicating, of getting their e-prescriptions, of doing that. Couldn't we have checked that out before we embarked and tried to find a way, to find a generic way to move this forward, instead of spending all that time and money to find out that it wasn't going to work? I mean, I could say the operation was successful, but the patient died. And so I'm suggesting that could this work not have been done beforehand in terms of a good analysis before you launched the program? Was that done?
We did do considerable research before we launched the program, including consulting with other jurisdictions that had national e-prescribing services in place. And on our team, we had clinicians, pharmacists, and technical people involved in the program. So I think they did take every effort to ensure that due diligence was performed.
But did that not tell you that it was going to not work because of all the different types of systems in every different province? Could that not have been the first step to try and make them talk to each other, to try and make them work, and then we could embark on this extensive project after that? Was that ever done?
I think it was, as I mentioned, we reported regularly on progress. We reviewed the progress of the system, and we tried to put measures in place. I think we tried to do everything we could from a due diligence point of view before we embarked on the program.
Thank you, Mr. Green. I want to thank you for the... Yes, the time is up for the next hour.
I just wanted to know if we could request of Mr. Green that all the documents that have been requested during this past hour, that he deliver them by the end of this week.
I will ask for the end of this week. Ms. Conans, I have no idea if that's acceptable or not.
I'd like to ask of Mr. Green that he deliver everything that was asked in the past hour by the end of this week. Thank you.
Mr. Green, duly noted in our minutes. And thank you very much for your time. Thank you. We now suspend for the next hour. Thank you. We're now beginning the third hour of our meeting. I note the time is 6 minutes after 6. So we will use that as our time limit to start off. I would like to welcome the witnesses joining for the third hour. They're from the Department of Health. Jocelyn Voisin, who has been here before, Senior Assistant Deputy Minister, Health Policy Branch. Elizabeth Toller, Director General, Healthcare Strategies Directorate. And David Jones, Director, Digital Health and Health System Division. Welcome. And I will just give you the quick procedure. One of you will have 5 minutes to present. And then we will move on to the question and answer session. And I will give you a shout out when you have a minute left so that you can wrap up and then finish up the questions and answers. So we'll finish off what you wanted to say. Thank you very much. Who is going to speak? Okay, Ms. Voisin, I will begin with you for 5 minutes, please.
Merci beaucoup. Merci, Madame la Présidente. Et merci
Thank you, Madam Chair, and thank you to committee members for giving us the opportunity to appear today.
Ceded territory of the Algonquin Anishinaabe. Alors, je souhaite d'abord situer prescription dans le contexte plus large.
I would like to set the context for Prescribe in Canada. The funding started in 2016, as you heard, in order to organize prescribing between doctors and pharmacies. And at the time, e-prescribing was not spread out throughout Canada, but a decision was made that paper had to be done away with for the security of patients' data. And from the start, Prescribe IT was designed as a digital platform, and it focused on service and clinical services, integration of pharmacies, evolution of workflows, and territorial and provincial digital systems.
We worked closely with provincial and territorial governments, pharmacies, and physicians to promote the use and adoption of Prescribe IT, and it was used by thousands of healthcare providers to transmit millions of prescriptions. It was conceived with a long-term vision to eventually become self-sustaining as adoption grew. And while early results were encouraging, adoption progressed more slowly than expected, and over time it became clear through performance monitoring and engagement with partners that Prescribe IT was unlikely to become self-sustaining as a single centrally operated national service. That finding did not reflect a lack of importance of e-prescribing as an outcome. In fact, provinces and territories have consistently affirmed the value of e-prescribing as part of modern care delivery. And what did not emerge, however, was a shared or collective request to sustain Prescribe IT as one federally funded and InfoWay-operated national platform. Provinces and territories are at different stages of digital readiness. They have different existing systems, different integration paths, and different cost considerations. In that context, there was no consensus around a single delivery model, even as there was strong alignment on the policy objective. The decision by Canada Health InfoWay to wind down Prescribe IT therefore reflects an evolution rather than a withdrawal from e-prescribing. And the focus has shifted, as you've heard, toward enabling common standards and interoperability so that provinces and territories can implement solutions that work with their systems while still supporting pan-Canadian connectivity. This approach recognizes the realities of a federated health system. It preserves flexibility for jurisdictions, avoids duplication, and supports long-term sustainability while continuing to advance the underlying objective of safer, more efficient electronic prescribing.
It's also important to note that a federal approach in the area of digital health depends on the collaboration with provinces and territories, which have to agree on strategic orientations and interoperability. But decisions made to the operations depend on governance structures and not a federal directive. In the case of Prescribe It, discussions between stakeholders were about long-term viability, flexibility of administration, and alignment with existing systems.
In advancing e-prescribing in Canada at a critical moment, And as the health system evolved, so too did the federal approach from operating a national service toward enabling interoperable solutions through standards. That evolution reflects stewardship, learning, and adaptation in a complex federated health system. It's about focusing federal pan-Canadian efforts where it adds the most value while respecting provincial and territorial roles in healthcare delivery. Thank you, and we're happy to take your questions.
Thank you very much. Well done. 4 minutes. Period. Starting with the Conservatives, Mr. Major, for 6 minutes, please.
Thank you, Chair. So thank you. Welcome, participants. What is the total dollar value of taxpayer funds allocated to prescribe it?
So we did get this question as part of a parliamentary question. So based on our records, our total value was $298 million.
Okay, thank you. The government spent over $250 million on Prescribe It, or $290 million, a program that was supposed to replace fax machines for prescription drugs. Doctors are still faxing 10 years later, and less than 5% of prescriptions go through the program. Was the $250 million, or $290 million, I understand, an effective use of tax dollars? Yes or no?
Well, we would say that Prescribe IT delivered a service over those years. It did deliver millions of prescriptions, as we noted. So it was value to taxpayers in delivering that service and setting the foundation for e-prescribing in the future.
Can you name a single federal performance target for Prescribe It adoption that was met on schedule? Yes or no?
I'm going to turn to my colleagues. Stats?
Hi. Thanks for the question. Certainly, there were performance targets with respect to the. So yes, there were performance targets, and some were met on target.
Some. So there were some met.
Yes.
Okay. Can you table those ones that were met?
Yeah.
And not met, or the whole schedule? Ms. Vozane, on June 19th, 2025, TELUS Health met with you to discuss, and I quote, government procurement, health. Was Prescribe It discussed during that meeting?
I do recall a meeting with TELUS. Yes.
With TELUS, yeah.
TELUS
Health.
I do have in my calendar a meeting with TELUS Health. At that time, we discussed the connected care agenda in general. I don't recall it being about procurement particularly.
Could you table any minutes from that meeting?
I will see if we have any minutes from that meeting.
Okay, thanks. Was the current Minister of Health or any other federal minister informed of Canadian Health Infoway's decision to terminate Prescribe It before the public announcement on February 11th, 2026?
Well, as Infoway noted, provinces and territories sit on the board of directors for Canada Health Infoway, so they would certainly have been involved in those discussions in advance of that decision being made public. And in addition to that, the provinces and territories are members of the corporation.
So was the current Minister of Health or any other federal minister informed?
Yes, well, the FPT ministers of health, so including the federal Minister of Health, are members of the corporation.
So on what date were they informed?
There was a health ministers meeting. Yes. I can't remember the exact date of that meeting,
Okay.
but we can.
And you could table those minutes from that meeting that they were informed, please. After Prescribe It ends on May 29th of this year, what intellectual property rights does the Government of Canada Health Infoway retain over technology built with over $250 million in federal funding? Is it none, some, or all?
It is some. I'm going to turn it to
Okay.
Dave.
Some is good. That's good. You answered the question.
May I ask a clarifying question? You said Health Canada or Canada Health Infoway retains the IP?
You can just table that. If you could table all that information, that'd be fantastic. Okay. Did Health Canada conduct a formal program evaluation of Prescribe It before signing the 2023 contribution agreement that allocated an additional $211 million?
Well, we do oversight of the contribution agreement as a regular course of business. So this isn't day-to-day operations of running the service, but we do exercise oversight through the contribution agreement according to the transfer payment policy. That includes work plans, budgets, reporting, and audit requirements.
Program evaluation, and those
It's
are
not
all.
a formal program evaluation from the department in what you're thinking of, I
Could
don't think.
could you table all those requirements, all those reports that you just referenced
The reporting, yeah.
Yeah. On Budget 2017, Budget 2017 promised that Prescribe It would be used to explicitly reduce opioid-related fraud and diversion. Can the department tell this committee with specific data how much of opioid-related harm was prevented by Prescribe It between 2017 and 2026?
I don't think we have that data.
What? That was a specific when the program was designed. It was actually Minister Philpott at the time actually referred to that. That was a major portion of this program, and you do not have that data.
We will look to see if we have any data, but I can't answer that question.
Oh, man, you wonder why. Prescribe IT is not mentioned in Health Canada's 2026-2027 departmental plan. Was the decision to remove it from the plan made before or after Canada's Health Infoway Board voted to terminate the program?
I'm pretty sure that the departmental plan probably references Infoway funding, but maybe not Prescribe IT, because the funding we provide to Canada Health Infoway is much broader than just Prescribe IT. It really supports the connected care agenda, so the interoperability roadmap and interoperable data standards for all health systems.
And then looking at it was a fundamental shift, though, in the departmental plan, because it was mentioned up until 2024, I believe, was the date. All of a sudden, there was a shift. It was just not mentioned. So if you could, is there anything referring to why it was dropped and why the lack of focus on Prescribe IT, that would be great. Is Health Canada or the federal government pursuing any mechanism to recover any portion of the $252 million spent on Prescribe It from TELUS? Yes or no?
Thank you. The time is up. Go ahead. Answer the question, please. But the time is up.
So Infoway, as we noted,
Yes or
holds
no?
the contract with TELUS.
So yes?
So Infoway holds the contract with TELUS. Health Canada does not have anything to do with the funds collected through those fees.
Thank you.
I now go to Mr. Ailson for 6 minutes, please.
All right. Thank you, Chair. Thank you all for coming. I guess one of the questions that I was trying it with the last witness. Do we know why the uptake among healthcare providers was so low of this? We were told many times that 95% of pharmacies agreed to take this up, but only between 5 and 20% of prescribers. Do we know why that was?
So I think that's a good question to ask. And what we heard is that the solution that was created was technically strong, and a lot of people enrolled to use it, but the use was low. And I think it boils down to some small irritants that made it difficult for the physicians to use. Many of them are not actually doing e-prescription today. They're using an e-fax or a secure email where a PDF goes, and there isn't actually sharing of data. But it was easy. It was a one-click thing. And so we heard some reports that they had to face multiple logins, or that it just wasn't as easy as doing the e-fax. So I think there was some integration and some basic functionality that could have worked better with the workflows of providers to make it a more stronger value proposition for use. I think the other challenge here is that provinces and territories are the ones who have the policy levers to incent adoption, and they could have potentially been involved earlier with Canada Health Infoway in driving that adoption from the get-go.
All right, thank you. So these irritants, you'd say, were these, I mean, this is difficult to say because I know you didn't develop the product, but these irritants or these factors that made it more difficult to use, would you say that is, for lack of a better term, a bug in the product?
think that the product was technically sound, but it could have been improved a bit more, and that probably would have required additional funding for it to happen.
All right, yeah, because we had heard, the answers from our previous witness. Without actually stating this, it seemed that there were just no problems with it. It worked perfectly, and it was physicians who were not physicians and nurse practitioners weren't adopting it, but we could never get a clear answer as to why that was. But it sounds like there were some technical issues that made it, more difficult to use than a fax.
Yes.
Okay, that's good to know. Yeah, would you agree that technically? I mean, I understand you might not have a big IT background, but would that not be a fault of a product that it's just not as easy to use as a fax machine when it's marketed as?
I think that we have to remember how complex our very federated healthcare system is and how much work it took to actually get the solution integrated amongst all the different vendors and the different pharmacy solutions. And so from that point of view, it did deliver well, and it was able to integrate. And I also think it was introduced at a time when some of the technology wasn't as evolved, so I think it could have been improved slightly, but it's not a significant gap, if that's fair to say.
Okay, thank you. Now, and you mentioned, we have this federated system, and we've had a lot of discussions about, differences with the provinces. Would more robust cooperation of the provincial health authorities help to make this improve the uptake in it?
I think all the provinces and territories broadly supported the concept of e-prescribing, and there is a very healthy level of collaboration. But as I mentioned earlier, I think that there could have been more involvement earlier on to drive adoption through incentives to ensure that the physicians were using it. There's a lot of focus on the technical side with vendors and prescribers.
Okay, thank you. Now, in regards to the actual product itself, now we're going to, as we heard many times, the Board of InfoWay said they're going to a standards-based approach. Is this product still available should any province decide to use it? If all of the provinces are deciding to, develop these standards and their standards are compatible with what was being done, can they use this piece of technology and software that was developed?
Yes, they can certainly have their own contract with TELUS, and as InfoWay noted,
1 minute.
They're going to provide the IP.
Okay, thank you. So the actual product hasn't been tossed on the trash heap, and that money hasn't been, again, for lack of a better word, flushed. Okay, thank you. So there is opportunity for that to be used on an ongoing basis with the provinces.
We hope more solutions will emerge.
More solutions. Okay.
Ready?
Okay. I think that is any question I have at this point will take longer to answer. So that's my time. Thank you, Chair.
Okay, thank you, Doug. I go now to Mr. Blanchette-Jonca for 6 minutes, please.
Madame la Présidente.
Thank you, Madam Chair, and thank you to the departmental officials to be here today. Who in the department authorized continued spending after December 2025? I did. Only you? Did you consult with the minister? No. I signed off on the contribution agreement. Why did you make that decision? Well, the final decision is made by Cabinet and the government, but I sign off on it. You said that you're on the board. Why did you continue to spend money on a program that wasn't working? Well, we were very clear with InfoWay that the objective was self-sustainability, that the product
expectation was that the service would become self-sustaining, and when that was not, when it was clear that that was not going to happen,
I'd like to add After November, there had to be a clear transition period with users, so we didn't just turn off the lights. There were users, so they had to be transitioned out of the system. So whether it was a total failure or a near total failure, it was a failure. How much money was spent after November 2025? We already had year-to-year funding. I'm looking for an amount here. We'll provide you that information. It's in the agreements we signed. So you kept on going during the transition. You don't know how much was spent, but it seems the amount was big enough because investments were still being made. If my car is broken, my mechanic is going to say it'll cost a certain amount of money, but the motor might break down. Well, the investment, there was money for the transition. How much money? We'll get back to you on that. We want to know why this was a flop. It's not reassuring if you can't even tell us how much money was being invested after you decided that it would end. You recommended it continue to the department? No. Infoway's board made the decision. What data did you use to say, we're going to pull the plug and we'll transition towards the end of the program? We made a study. We did a study in 2023 because we started to see that there were problems with adoption, with uptake. You're saying problems were seen in 2023, but it was only in November, December 2025 a decision was taken. So it took you a couple of years to make a final decision. Yep, we undertook a study. Infoway reviewed its uptake processes and looked for other viable options. I'm just wondering, for what reasons did you make that decision in November of 2025? Well, that was Infoway's process. Did the department have an internal review of Prescribe It? In 2023, we gave a last amount for 3 years, and we were very clear this is the last time we would give out money, and we wanted a sustainability plan. We then we told Infoway to assess alternatives. But what was the 2025 decision based on your determinations in 2023? Infoway looked at other options. You're saying it took them 2 years to conclude it was a flop? Well, they were looking for other viable options. And as you heard, several proposals were on the table. But ultimately, the decision was made by the board of directors. And the board of directors recommended that you transition to another system? Yes. With the Infoway process, we conducted our own analyses. So it took you 2 years to finally pull the plug. Is that a normal time frame? 2 years to decide whether a program is working or not? Yes. We have a very complicated healthcare system. We have discussions for the provinces and the territories. Can you give us in writing the notes that had been given to the minister, the amounts spent after November 2025, and I want to know what the transitional costs were for the provinces, including Quebec. Yes. Thank you.
Please, all of those requests for sending things should come through the chair. The chair will receive it, the clerk will receive it, and we will distribute it. Thank you very much. I now go to the second round for 15 minutes. I understand that Mr. Bailey and Ms. Conans are sharing 5 minutes. Okay, go for it.
Thank you, Chair. My first question goes to Ms. Voisin. You're aware that Saskatchewan is still on paper. They do not have EMR systems. Is that correct?
No,
that's not correct.
I don't think that's correct. I'm
That's
sure
not correct?
Saskatchewan has EMR systems. EMRs are deployed individually in different physician offices, so maybe not all physicians are using EMRs in Saskatchewan, but I'm pretty sure that many are.
Okay, let me reword the question. Let me go. You knew that Alberta was going to Connect Care, not the C5 Connect Care that some people refer to. You knew that Alberta had invested $1 billion. What did you feel the uptake was going to be competing with a system like Connect Care that Alberta had?
I don't think this is a question of competing with a system like Connect Care.
Why would you go into Alberta and think that you were going to get them to use a system for prescriptions, knowing that they had a system that was working very well for them?
We did not go into Alberta, as you say. Canada Health Infoway had a mandate to look at a national e-prescribing service. As I said, all the provinces and territories are members of the corporation and do make decisions related to Infoway and its programs and over, sort of the strategic directions of those organizations through the Conference of Deputy Ministers. So Alberta was very well aware of what Canada Health Infoway was undertaking.
Ms. Combs?
Thank you. I have a few questions. $298 million was spent on Prescribe It, and now we're transitioning into another system, another program. Do you and that was $298 million was spent in 8 years. Do you? What would you say about? I mean, is it going to be another $298 million in the next 8 years? That is going to be spent by taxpayers,
No.
Canadians. No. Okay, and why not? Why do you think it'll be a better deal in the next 8 years than it was in the last 8 years? If things go the way they did, how do you know that you're not going to need to spend $298 million?
Well, we're transitioning. Well, in Canada Health Infoway is transitioning to a standard-based, system, in a sense that they're coming up with interoperability standards that vendors will then be able to use to ensure that those systems can talk to each other, and provinces and territories can make the decisions about which e-prescribing service they want to use that will be integrated into their own EMRs.
Will this be with TELUS?
Not
No.
necessarily. If I may,
ahead.
the goal is to introduce standards so that there can be a variety of IT solutions for e-prescribing that the provinces and territories and health organizations can choose. And the benefit here is that if you have a common standard that all the provinces and territories are following, it reduces the cost for vendors and for the provinces and territories to have to customize the solutions according to the unique requirements.
So each province is going to
cost effective in the long term.
Each province is going to decide what they want to do
They
separately.
get flexibility, but with an alignment to a common standard, so the solutions can talk to each other. That's the goal.
So given all that you've said today about this 8-year failure of Prescribe IT, why should Canadians trust any of that, anything else that comes forward? I mean, why should Canadians trust a new system that you'll be bringing forward?
So taxpayers supported the establishment of a service that provided a service for them over the last 10 years. And while the adoption rate didn't meet the scale that we were envisioning, what you see here is stewardship. We saw the adoption rate was not what it was going to be. It was not going to be self-sustaining. And so the federal government made a funding decision to Canada Health Infoway and pivoted. So that's stewardship.
It pivoted after $298 million. That's not really a pivot to me.
For
That's
10 years.
for an uptake of what, 5% maximum. So would your goal be will be successful with a 10% or a 20% uptake? What's your goal here?
The goal was for the system to be self-sustaining with adoption rates. It was clear that it was not going to reach that goal. So as a good steward would, we did the analysis and we changed course. Now, over that time, though, it provided millions of prescriptions and it provided a service to Canadians.
Time is up. I now go to Ms. Sidhu for the Liberals. 5 minutes, please, Sonia.
Thank you, Madam Chair. My question is on the digital side, so I will ask Mr. Jones. Mr. Jones, how important is a strong data sovereignty in Canada's health system, and how do we ensure that patient information remains secure and within Canadian jurisdiction as we modernize digital care?
Thank you for the question. Certainly, data sovereignty is a foundational aspect of our health data system. We want to ensure Canadians that their information is going to be protected and that it's going to be safeguarded, particularly in light of concerns on privacy and cybersecurity. There's lots that can be done to enable systems to become more sovereign and to protect that data. Standards is a foundational aspect of that. By applying standards, you can embed cybersecurity requirements within health systems and enable the protection of data. Data residency is another requirement. Often it's contractually obligated at the time being, but the data remains within Canada, within servers that reside within Canada is one way that the sovereignty of Canadian data is protected.
So to follow up, could you explain how improving access to accurate real-time health data directly supports better clinical decision-making and safer patient care to amplify that? Any of us?
There are significant harms when health data is not shared with individuals and with providers. Today in Canada, less than 13% of Canadians can access their complete health information, and that includes their prescriptions. And while many providers are using electronic medical record systems, less than half of them are actually sharing that electronically, and they cite the major barrier is a lack of interoperability. When healthcare providers don't have the full picture in front of them to make good decisions about healthcare, it can lead to misdiagnosis, the wrong treatments, repeated tests. It's not only an issue of an inconvenience and an inefficiency for them because they're spending millions of hours searching for information. It can actually lead to real patient safety risks, and in some rare cases, even death. It's especially worse for those with complex conditions or those that live in rural, remote areas or Indigenous communities that have to see multiple specialists across different sectors or even across provinces and territories, which is why we need better flow of health information through standards and interoperability.
How does a bill like S5, the Connected Care for Canadian Act, support greater competition for digital health solutions in Canada? And how does Bill S5 help address the type of data sharing challenges?
Yeah, so at the heart of what Bill S5 is about is exactly what I just described. It's to reduce patient safety risks by avoiding the harms from disconnected care, with a goal of enabling patient access to their own records and to providers so that they have the full information they need to deliver high-quality, coordinated, and seamless care. But it, of course, has benefits for industry as well. As I noted earlier, they have a very complex innovation environment that they have to work in right now. They have to customize their solutions 13, 14 different times according to different jurisdictional requirements. And so Bill S5 will help set a level playing field through a consistent set of national standards that are internationally harmonized and already required by other jurisdictions around the world, which helps create more predictability for vendors and helps reduce costs for them over time. Many of the vendors have said they're in strong support of standards in the legislation.
Thank you. Madam Chair, how much time have?
You have 1 minute and 3 seconds left.
Okay. Can you, Ms. Vinson, can you walk the committee through the decision to end the program, including what factors led to the conclusion, where are the gaps, and how that gap can be improved with the provinces so we all can work, federal, province, and territory can work together?
So in terms of the steps in terms of the decision, so just to be clear, the decision from the federal side was related to funding, and the decision to move to a standards-based approach was made by the Canada Health Infoway Board of Directors. So from the federal perspective, as I noted, we undertook an assessment in 2023. Once we saw from the federal perspective that adoption rates were not as we had anticipated, which meant that the plan that we had initially put in place for self-sustainability was not going to be met. So we put a study in place. We're happy to provide that to the committee. And Infoway then also started a public process, so a request for expressions of interest to see if there was another viable path forward for Prescribe IT. And that process was undertaken by Infoway, considered by the Board of Directors, and eventually a conclusion was made that none of those proposals that were brought forward were viable. And so the board decided to move to a standards-based approach.
Thank you very much. I now move to Mr. Blanchette-Jonca for 2.5 minutes, please.
Merci, Madame la Présidente. Je veux savoir,
You said that you agreed with the transition. You didn't want to pull the plug. There were some users, though. What concrete results came out of that transition? Well, the transition is not complete yet. Well, what are the concrete results to this point? Of the transition? Yes, you're still spending money in a program you've deemed is not working anymore. You're transitioning, you're ending the program. So what was the point of keeping on investing in a program that wasn't working? That question might better be for Infoway, but under our agreement, they work directly with those who use the service to make sure that the users have what they need to keep on the work. What are your performance indicators? You're still investing money. You're still giving money to Infoway. You're saying you trust them, close us the file, $250 million later. Well, there are standards. How do you measure results from the transition? We expect that standards be implemented before May 1st. Thank you. I'm looking forward to seeing that. After the failure of Prescribe It, we've got Bill C-15, connected health across the country. Do you think this is a new fiasco in the making? Bill S-5 is not an infrastructure bill. It's setting standards. As I already explained, that's the objective. We want to create a consistent environment between provinces and territories so they can share the same standards and therefore they can use whatever tools they choose. Well, we know that the government is no champion when it comes to standards, as we've seen with Phoenix and Curam. What is it about the federal government that it cannot achieve where Quebec has succeeded? It's important to have national standards because the industry does not want to have to adapt to provincial standards for each province. The industry wants a pan-Canadian alignment. So the industry is deciding for taxpayers, or is government deciding on how to spend taxpayers' money? The federal government does not develop the standards. Experts will do so. But the federal government has to implement them. No, the federal government does not implement them. Canada Health Infoway and CIHI, the Canadian Institutes for Health Information, set those standards.
To Mr. Strauss for 5 minutes.
d'avoir une réponse écrite juste pour pouvoir poursuivre la.
Could we perhaps get those answers in writing?
They'll come to the clerk and you'll get them. Thank you.
Thank you, Chair. Ms. Voisin, you mentioned in responding to one of my colleagues that an analysis was done uptake was found to not be good enough. A stewardship decision was made. May we see that analysis? Can it be tabled with the committee?
Yes, I already offered to table that analysis.
Fantastic, thank you. You talked about pivoting. So we had this prescribe IT system. The government is now pivoting to an open standards system. How much money is going into the open standards system?
We will be providing $50 million to InfoWay to carry out its core mandate, which is to drive adoption of interoperable digital tools and enable sharing of data.
And so I take it that it is your belief that InfoWay did such a bang-up job with the last $300 million that we should give them another $50 million to execute this pivot on behalf of taxpayers?
They're very different programs.
I think we want to make it very clear that the main agenda for Canada Health InfoWay is the Connected Care agenda, developing those interoperability standards. Now, the Prescribe IT program was, as she noted, a very different program that started in 2016.
There's no suspicion on your part that Canada InfoWay is totally not fit for service, just blew $300 million. Maybe somebody else should be in charge of this.
Part of the assessment that we'll share with you will demonstrate that there is no other player in Canada that is suitable to play this role. And they have actually done a lot of great things over the years, in addition to their work on prescribing. Such as they are responsible for getting all of our providers using electronic medical records, the 95% use that is now happening today. They are responsible for all the virtual care work.
I'm going to cut you off there, madam. I don't think that's true.
It is true. Their original goal was to enable use of digital tools, and we have succeeded 95%.
Miss, my hospital was using electronic medical records before Canada Health InfoWay ever suggested it.
2001, it was their goal to enable electronic health records. There were no standards at that time, and now their goal is interoperability.
Thank you. When did self-sustainability become a goal of the Prescribe IT program?
From the onset.
Ms. Voisin, you described that there was a vision, it was a national vision, healthcare is so complicated, every province and territory has its own needs in different regions. Would you say at this point that the vision was impossible?
I would say that we had very good results in the early days of Prescribe IT. Lots of enrollment for pharmacies, for physicians, and it wasn't until later that we saw the adoption rates based on that enrollment were not, meeting the expectations. The provinces and territories are very engaged, as we noted. There are several of them on the board of directors of InfoWay. They are engaged through the Conference of Deputy Ministers and through the FPT Health Ministers discussion. So they also have evolving health systems and evolving ways in which they're deploying health information in their health systems.
So it wasn't possible. A grand national project was undertaken, and it wasn't possible. Like you're not able to tell me that somebody could have done something different to make it possible. It wasn't possible in 2017 for this project to succeed and be self-sustainable. It is not possible today, hence the pivot.
I think we learned from this. We set the foundation for e-prescribing in Canada. Canada Health InfoWay proved that the technology is possible, that it does exist, and it set the foundation for e-prescribing use.
You said that some period of time was undertaken for users to transition. Dr. Bolton is a family doctor in St. Thomas, Ontario. He's been in the CBC saying he has not been transitioned. A friend of mine in Kawartha Lakes is a family doctor. He says he has no idea what is going to happen with his prescriptions a month from now. Are you aware of this? Like the users, the physicians don't feel that they've been transitioned in any way?
So I think Canada Health InfoWay is working with the provinces and territories to support that transition.
Okay, thank you. I'd like to give my remaining time to Mr. Mazier.
Thank you.
Mazier has 42 seconds.
Thank you. And with that, I would like to I'd like to present a motion. And it's in light of what we've actually found out here today. There's still lots of unanswered questions, and this is basically a list of what we would seek for documents. So that the committee order the production of the following documents unredacted from a period of 2016 to present. A, contribution agreements concluded with Canada Health InfoWay relating to Prescribe It. B, a record of intellectual property developed under Prescribe It, including the entity that holds the rights and the general terms of use, licensing, or transfer. C, annual adoption data broken down by province. D, the total revenue generated from the 20 cents per prescription fee. E, viability analysis and program evaluations. F, documents that led to the decision to terminate the program, including recommendations and analysis provided to Health Canada and to the Minister where applicable. G, a list of principal vendors involved in the program, including the amounts paid to each. H, documents and analysis related to the costs of terminating the program, including contractual obligations, penalties, and transition costs. That these documents be provided by Health Canada and Health Infoway in accordance with their respective responsibilities and deposited with the clerk of the committee within 1 week of adoption of this motion, and that any redactions be limited to commercially confidential information, and the summary of redacted content and the reasons for such redactions be provided.
We now have a motion on the floor. Is there discussion on the motion? Ms. Sidhu?
Madam Chair, can we suspend to discuss? We want to discuss them.
All right, we will suspend for time for discussion. I am wondering if I should ask. we have a motion. We have a motion on the table. Discussion, Mr. Elson.
Thank you, Chair. Yeah, we reviewed it, and this is a very, it's a long, wordy motion, and we believe that there are elements in this that we can support, but to give unanimous consent at this point, without more time to review it in detail, we were wondering if we could have the consent to move this motion to Thursdays and discuss it fully on Thursdays once we've had time, because this has just landed on our desks, and to ask us to give unanimous consent on a motion that has just appeared in front of us is a very difficult proposition, and we want to make sure we're making a responsible decision.
So, obviously, I don't have to ask for unanimous consent. You don't have it, Mr. Major. So, anyone else to speak on this? Is there a response? Do the Liberals have the time they're asking for? Yes?
Madame la Présidente,
Maxime?
je pense que c'est assez simple à prendre une décision.
I think it's pretty easy to make a decision. Do they want transparency in view of a $250 million failure, or are they just ragging the puck? We're not getting answers to our questions. We're asking for written answers. We've been asking for government transparency from the start. Now, this is why we're here today. This is why this motion has been tabled. We simply want to know how taxpayers' money was spent. That's all.
Elson will respond. Doug?
All right, thank you, Chair, and thank you, Mr. Blanchet-Jonca. And that the point is very well taken, and wanting this information is a very reasonable request. But again, these are long. It's a long, complex motion. There's a lot to review, and we again want to make sure that we are making a responsible decision, as we might have amendments on further reflection that might be acceptable to all parties. And I think it would be irresponsible with committee time and with committee business to make this decision prematurely on something that I think we all agree is very, very important. I think, we all want to make good decisions, the right decisions in this place. And this is why I'm asking that, because if you see what we're trying to accomplish here and what we're transitioning to, and we can go forward better with a better review at this. Because, at the end of the day, what we're talking about is the interoperability of health systems, and how can we better improve that? And what lessons can we learn from the past, and how we can take that information and go forward and apply that to the position, to our deliberations on this bill, and to decide if we will take it on its face or whether we will take it on or suggest amendments that, again, the opposition may find acceptable. So, again, it's about the responsibility of this committee to make the right decisions. Because when we're dealing with an issue like that, we're dealing with issues of medical technology, medical information, and it ultimately comes down to patient safety. We owe patient safety. We owe them accuracy. We owe them efficiency. And we want the efficiency of not having to repeat the same mistakes again and again and again. We know that there is problems with medical record keeping, that we have a myriad of systems. I've worked in some regions where within one city we have different medical record systems. I do know the hospital that I was just recently working at within the last year still on the floor has its own paper charts. So we're not quite there yet, and we need a lot more development and a lot more time. And if we're going to make the right decisions, again, it is in the best interest of safety of all Canadians to make sure that in all of our motions regarding this, that we're making the right decision. Because we know that in the interoperability of medical records, medical record keeping, the transfer of information. We do know Canada is failing in this, and this is what we need to improve. And we do know that Prescribe IT helped illustrate a lot of gaps in our system. It showed that there are provincial systems that are they are unique, and they have their own reasons for thinking that this is how it should be done there. We have medical practitioners in different environments. We don't know how much the medical practitioners were consulted in this. And we know that we will not have progress unless we are making sure that all of our facts are properly reviewed, and that we can then make those decisions properly and safely. We talked about how, in the year 2026, we're still using fax machines. I did my last clinical shift in October. We were still faxing handwritten requisitions to the X-ray department, and that's how we're still ordering X-rays today. It's not a minor inconvenience. It's a structural failure in our medical technology system. Again, going back to why we have to be making the correct decisions in all issues with this, including these motions. We do know from the testimony on this issue that things were done without enough consultation. We do know that a lot of healthcare providers obviously didn't get asked the right questions. Decisions were made without enough information to make them, which again speaks to this motion. If we are being asked to make the decision on this, having just seen it, and just to accept it on face value without a fulsome review, then again, we are compounding the mistakes that we have made before. And we are no further ahead. And I'll thank the amendment not to interrupt me while I have the floor. Sorry, yeah, well, you're interrupting. Maybe, Madam Chair, Mr. Minister is interrupting, and he needs to stop.
I know. I was just about to say this. Debating across the floor is not okay. Go through the chair, please. If you have a question, put your hand up. I'll recognize you. I have a list here. I have a list of people discussing this motion that's on the floor. That is a process that we have to undergo. And in the meantime, before Doug, I'm sorry, you still have the floor. I would like to thank the witnesses for being here and tell them that they may leave with our blessing. Thank you. The witnesses could go. They're not part of this motion. The committee is debating a motion.
We still have time. Don't you still have time for?
We only have resources, I will tell you, until 7:20, and then we must leave. Now, we have a motion on the floor. It is the procedure to debate a motion. We have Mr. Elson speaking. I have Ms. Sidhu on the list after that. So I think that, I'm following procedure, guys. That's it. Mr. Elson, go ahead.
All right. Thank you, Madam Chair. As we've said, as I've said...
Rappel au règlement, Madame la Présidente. Oui, donc, quelle est la procédure pour laisser partir les témoins? Est-ce que ça, c'est...
What are we doing with the witnesses? Can they leave on the order of the chair, or do we need unanimous consent?
It's just to leave because we have a motion, and I do not see them having to stay here until 7:20, only to have to leave then.
Quelle est la procédure, Madame la
I'm
Présidente?
being respectful of the witnesses.
Quelle est la procédure?
What is the procedure you are invoking?
I may ask the witnesses to leave if the time that they came for is up and if there is something else on the table. And with my experience of watching my list here and looking at the time, we have 15 minutes to go. Mr. Elson is speaking, Mr. Dew is next, and so I do not think we will get back to the witnesses.
Je vous parle de la procédure, Madame la Présidente, pas de votre expérience.
I want to know what the procedure is that you are invoking, not your experience.
Do not wish the witnesses to leave, Mr. Jonka? Be it on your head.
Je vous demande la
I am running
procédure,
this
Madame la
meeting.
Présidente.
Pardon?
I'm just asking what the procedure is. What section of the standing orders?
Witnesses to leave, and I'm asking the witnesses
Sans le
to leave.
consentement du
Thank you.
comité?
Without consent of the committee?
in debating a motion that was put in
Chair,
while
point of-
we were dealing with this issue.
Yeah, point of
This
order.
motion was put in knowing that a motion can be debated. It was
Yeah, point of
unfair.
order. If we just vote
The
on it,
witnesses
away
were
we go.
asked, excuse me, in the motion that we are now studying based on the motion, the witnesses were asked to appear for an hour. The hour is now very well over. Thank you. You may leave. Thank you. Mr. Elfson, go ahead.
All right, thank you, Chair. And part of this, too, of this discussion on why we need to be making the right decisions is we are going to be shortly debating and voting on S5, which is going to be another integral part of developing our medical technology. We do know that, shockingly, about 29% of physicians in Canada are currently exchanging medical records across different points of care. This is 1 in 3 physicians. So this means in the overwhelming majority of cases, when a patient is being referred to a family doctor, to a specialist, transferred between hospitals, or even seen at an urgent care clinic, the receiver provider is working at least partially in the dark. It has been described by some as simply flying blind. And this is not between provinces. This is within provinces. This is sometimes within the same city. And this is the status quo that S5 is designed to change. And it's not gradually and not through another round of well-intentioned, but ultimately lacking guidance. We do this through enforceable national legislative framework, which again needs proper debate and proper review, like this motion that needs proper review prior to approving. Because it goes further into what we've just seen in and heard in our testimony, that Prescribe IT offered a concrete example of technology in healthcare action, and by allowing prescriptions and renewals to move efficiently between providers and pharmacies, and it was supposed to be an answer to this problem. We found out that without the fulsome study that it needed, there were failures in the problem with it because there hadn't been the proper discussion amongst the end user providers, and hence uptake of only, in some provinces 5%, at tops at 20%. So this tells me that a very well-intentioned initiative was did not have the study at all levels that it deserved. And anything done in this committee has to have the proper study that it deserves. So, a lot of us on this, many of us have worked on this legislation in S2, have drawn inspiration from Greg Price, a young man in Alberta who died in 2021 at the age of 31 from complications of surgery. Young, otherwise healthy, and in the care of what we should have thought was an adequate healthcare system. But his journey was marked from the very beginning by the problems that we seek to address. Health records were lost. Information was delayed. The digital tools and data systems used by the providers involved in his care could not communicate with one another. The providers themselves, despite their best intentions and professional competence, were operating without the full picture. The result was catastrophic and irreversible. And Greg is not alone. So in debating issues like this and preparing legislation like S2, we have to listen to Canadians from across the country who've had their own encounters with gaps in the system. We have to be listening to the healthcare providers, including the 80 to 95% of healthcare providers that did not actually use this very expensive system that was brought in. We have heard from healthcare providers who order post-surgical lab work for a patient. Results completed, never making it back to the ordering provider. Had they been received in time, the provider would have known the follow-up was urgently needed. They were not received. Patient deteriorated into a life-threatening crisis that never should have been allowed to develop. Another example of what happens when you don't properly review the actions you have to take in legislation or in committee. There are numerous examples.
May I suggest, in the room. There is a member speaking to a motion that was brought forward by the opposition, and therefore I would ask that you respect at least listening to the debate on your motion. Thank you. Go
Thank
ahead,
you.
Doug.
Yeah, and these are not random cases or cautionary tales invented for policy documents. They're events that unfold in Canada every day. And they share a common root cause, the absence of a connected, standardized, accessible healthcare data infrastructure. And because we are here to discuss such things, every decision needs to be done with proper care and attention. Beyond the direct patient harm, this systemic disconnection also results and imposes a profound toll on the people delivering care. Physicians, nurses, allied healthcare professionals are exhausted. Burnout in the care sector is at levels some would describe as a national crisis. I have spent many years working in this system myself and was in that system, working in that system within the last year. I have been a patient in that system where I had a sudden catastrophic medical event in another province. My doctor had to phone and fax results to Vancouver. When I was discharged, I was given an envelope the size of a shingle full of medical records and told, give this to your family doctor when you get home. There was no secure electronic way other than giving me an envelope of documents to take home on the plane so my doctor would know what happened to me. So this is very real, and we want to make, and we already have seen a program that did not do what it was meant to. And part of that was because we made decisions without proper care and attention, like approving this motion without having the proper time to review it. So we need to speak plainly about what we're trying to do here, and legislation like S5. It's very important legislation, and it will fill the gap behind prescribed IT, which is crucial.
Donc, le collègue député parle du projet de loi S5. La motion ne parle aucunement de...
S5 is not mentioned at all in this motion. I don't know why we're talking about S5. We want to talk about documents to be produced.
Nelson, please.
Yes. In response to Mr. Bachet-Joncar's question, it is about the overall issue that we're discussing about. That we are discussing, and why it is so important to have the proper information before making all decisions. My only request at the beginning of this debate was not that we vote down the motion, but that simply we have 48 hours to review it so that we can make sure we're making the right decision. The opposition is wanting us to make this decision prematurely when we haven't had time to adequately review the information. And the information I'm giving here is all the context as to why we have to have all the information at hand that we need, because there are some members who don't feel that we need to be doing this and that we should just accept this motion at face value that we look at once and then immediately vote on it. If it is such an important motion, and if it is such a reasonable motion, then I fail to see how the opposition can object to waiting 48 hours, and we can pick up the debate in 48 hours once we have had time to properly review this legislation. This has been a common practice among the opposition on this committee, that at the very last minute, sometimes at the end of a meeting, a motion appears in our mailbox the second that members start reading it and claim that, well, it's just a simple motion and we shouldn't have any problem passing it because there's nothing unreasonable here. Well, if there's nothing unreasonable in these motions, then I have to ask, why does the opposition not want to give us the time to verify that this is a reasonable motion? And given the length of this motion, the very few minutes we've had is not sufficient to make that. All right. At this point, if anyone would like to interject to suspend the meeting at this point and pick up debate on Friday, I would be very amenable to that. Thursday. Pardon me. Yes. Thursday. Yes.
Any objection to suspending this meeting so we can pick it up on Thursday? Okay? Sorry.
Nous avons les ressources jusqu'à...
We have resources until what time, Madam Chair?
Times. It's until 20 minutes after, so the meeting should end now. It is now 1 minute or maybe 30 seconds. If you wish to wait for 30 seconds, I will suspend the meeting then. Is everyone in agreement to suspend the meeting? Do I have unanimous consent to
On veut
suspend?
voter, Madame la Présidente.
No, I have not.
Vote? We cannot stay here, so I don't know. We could go out on the street, maybe, and continue this meeting, perhaps.
Oui, yes. Pas de problème.
I asked, clearly we have no more resources. We have to leave this room. I beg your pardon, Mr. Major, if you wish to say something, please say it so I can hear you in the microphone.
You do not have UC to suspend.
Well, then I will adjourn the meeting.